go ahead and call the Cumberland County Board of Commissioners regular agenda session to order for April 10th, 2025. Thank you all for being here today. Hopefully we'll have a very productive session. I know we have a few things on our agenda today. If you'll go ahead and rise with me if you're able for the invocation of the pledge. My chairman's trying to help you out there.
Okay.
Heavenly Father, thank you for allowing us to be here today on this beautiful day. Guide us as we go through the work of the people of this community. Guide our discussions, guide our temperaments, and let us make decisions that are in the best interest of the people in our county. In your name we pray. Amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, we'll go ahead and move to item 1, the approval of the agenda. County Manager Greer, any additions?
Yes, Chairman Devier, there's, excuse me, one item we need to pull, item 3C, 2025 Ag Cumberland Grant Program for Individual Farm Operations. And then we need to add a closed session for attorney-client matter pursuant to NCGS 143-318-11A, paragraphs 3 and paragraph 4.
County Manager, can you give me those closed sessions again? And I think we need additional one for personnel actions C6.
And C6. 3, 4, and 6.
Okay. Thank you, County Manager. I'll entertain a motion for approval of the agenda with the addition of the closed session. You have a question?
Yes.
Commissioner Tyson.
Thank you, Chairman Devier. Just wanted to ask, we have the Sheriff's Department here to present item 6D, and I'd like to request that be moved to 6A and that item 6A be substituted in that place, Mr. Chairman.
Without objection. Without objection, so moved.
I would like to add one item 3D, tax payment to the Internal Revenue Service under 3. I guess it would be 3D. Even though we pulled item 3C, this would be 3D income tax payment to the Internal Revenue Service.
Okay. Okay, so let me just review it. We are adding a closed session. We are removing item 3C. We're adding item 3D, tax payment to the IRS, and we are moving item 6D to 6A.
To what?
6A. We're just moving it to the front.
I'd move for approval, Mr. Chairman.
Say that again, Commissioner Fairclough.
I would move for approval of the agenda as
Thank you.
amended.
Is there a second?
Second.
All in favor of the approval as agended, raise your right hand.
Unanimous.
Thank you, Board. Thank you, staff. We'll go ahead and move to presentations. 2A, Alliance Health Services Expansion Proposal for Cumberland County.
Yes, Chairman Devier, I'll turn this over to Heather Skeens, Assistant County Manager, to present this item and present representatives from Alliance Health. And then after the presentation, they'll answer any questions you may have. Well, the board may have. I'm sorry.
Good afternoon.
Good afternoon.
I have Rob Robinson, CEO, and Kelly Goodfellow, the Chief Financial Officer from Alliance Health here, and they're here to present the plan for expanded services to Cumberland County. Additionally, Dr. Green will provide how the expansion of services blends nicely with how the health department is utilizing opioid settlement funds and other grant funding in our community. This plan has been developed after multiple meetings over 2 years and begins to address several gaps in services. And so with that, I'll turn over the presentation to Robin Kelly.
And Assistant County Manager, we also have our DSS Director here as well.
Brenda Jackson is
Okay.
here. She's
Just wanna
not
make sure.
presenting, but she's certainly here in the
Okay,
audience, yes.
thank you.
I'll hit the right button one of these times. There we go. Good afternoon, Commissioners. Again, Rob Robinson, CEO with Alliance Health. I have Kelly Goodfellow with me. She is our Chief Financial Officer. And as Heather mentioned, we are here today to give an overview of our proposal to improve and expand care. Now, I do need to mention the chief author of our proposal just so happened to be going on vacation today, so somehow I got asked to be here. While I'm certainly versed, if you have questions, if I can't answer them, we'll certainly take them back. So let me, first off, if Alliance Health, if you're not familiar with Alliance Health, we are what's referred to as a LME MCO. LME stands for Local Management Entity, and that's about managing care for people with mental health, substance use, and intellectual and developmental disabilities who are uninsured. We use state dollars and then the county dollars you give us to deliver that care. MCO stands for Managed Care Organization, and that's about managing care for people with severe mental health, severe substance use, intellectual and developmental disabilities, and those with a traumatic brain injury. We are not a service provider. We contract with 4,000 providers across the state. We have 15 awesome staff who are responsible for helping ensure services are available to Cumberland and across our region. We operate in 7 counties across the state: Wake, Mecklenburg, Orange, Durham, did I say Harnett, Johnston, I think, and of course Cumberland, and that's our catchment area. We are one of 4 Taylor plans, and the other 4, one is in the west, Via Partners is in the central west, and then Trillium operates in the east. So before we jump into the slide, Kelly wanted to make a few opening comments about the funding and why we're here today.
Thank you again. My name is Kelly Goodfellow, Chief Financial Officer. Before we get into the presentation, I just want to provide some context as to what led us to have an accumulation of fund balance that allows us to be here to present a proposal to expand services. For several years, Cumberland County has had a funding agreement with Alliance Health to provide funding for members who are uninsured and primarily in the areas of outpatient and crisis services. Prior to COVID, those dollars were fully utilized. At the start of the pandemic, Alliance started to receive an abundance of state and federal dollars in order to help stabilize providers, encourage members to continue to receive treatment, and encourage new members to seek treatment. Through the time of the pandemic, we never really got up to that level of pre-pandemic services. Also, at the time, we were going through a transition in our facility-based crisis, a transition of ownership. It's now Cumberland Recovery Response Center, formerly ROXI, and so that was also at that time. So that led to an accumulation of fund balance for a few years. Then on December 1st of 2023, Medicaid expansion was launched. This allowed members who were receiving services under state dollars to receive services under Medicaid dollars. They're again allowing an abundance of state dollars to be available to be utilized and not really having the need for local dollars. So again, an abundance of dollars remaining. As of June 30th, 24, we have a little less than $9 million in a restricted fund balance on Alliance books held for Cumberland County purposes. So I'll go into a little bit more of those projections and the financials later on in the presentation. First, Mr. Robinson will talk about the rationale for the expansion of services, as well as what we have done in the community thus far. And I pushed a button, I'm sure.
It's okay, Kelly, I break it all the time.
Just disappeared on me.
And then advance. This way. Oh, wait, do it this way. Do both.
Thanks, sir.
Thank you, appreciate it. All right, so how did we get here? So this has been an ongoing effort. As Heather said, it's been a couple years in the making about how we get the best proposal forward and make the biggest difference in Cumberland County through expansion. So there's a couple ways we did it. One is certainly conversation with some of you about what you think the needs are. We also do a detailed needs and gaps assessment to determine, that includes focus groups, that includes reviewing our data. That helped paint some of the picture. And then we talk with our providers and our members about what some of the needs and gaps are as well. Another thing that came about Medicaid expansion, I will say that has worked perfectly across the state of North Carolina in that it got many folks that were responsible for serving a payer through Medicaid, right? So as a result of that, more people can get the services they need through Medicaid, which has a much more robust benefit package than what it has under just state and county dollars. So that's worked out well. We've been able to shift some money back into expand care, money saved through folks coming to Medicaid. In terms of long-term sustainability, we looked at what services are available and what we can pay long-term, right? There's a lot of ideas about expanding services, but that would put the burden solely on the county to try and fund. So the programs that you're about to see put the onus on Alliance as well as the county, and we think it's much more sustainable. Again, there's still going to be needs in the community, but what we're recommending will have the biggest impact. All right, so service expansion is not new to us. Because of Medicaid expansion, because of some money we had in COVID, and because we are a public health plan, one of the things that I enjoy about being part of the public system and not the private, money we save, we reinvest back into care across our communities. So in the past 2 years, we've added 37 providers to the network. Just some of the things we've done, we've added peer support and assertive outreach and engagement. Multiple providers operate that service. As you can imagine, given that we serve individuals with some of the greatest needs in your community, they're not always ready to engage in treatment. And so assertive outreach and some peer support work is designed to help them get engaged. We're focusing on folks that are discharged from the hospital, are homeless, cycle in and out of the criminal justice system. Some are involved with social services. And so we're very proud of the work that's been done to try and expand that care. Also, again, because of the needs of the people we serve, we have expanded assertive community treatment team and community support team. Those are team-based. They have a team made up of psychiatrists, peer support, clinicians. They are working in the community to try and serve the individuals assigned to them. Another thing that we've done is we've worked to have City Block be a prominent provider in the Cumberland community. For those that are not familiar with City Block, in North Carolina, they're in Cumberland. We also work with them in Mecklenburg County. They work across the country, and they're one of the best at working with individuals with significant mental health and substance use needs. What's nice about them, it's not just office space. They do work in the office and in the community where they're at. Some of the services they provide are primary care as well as behavioral health, med management, and therapy services. All right, residential services. I know that's been a hot topic, not just with Cumberland, but across the state. We have tried several things to try and meet the needs of kids with severe and complex needs. We contract with 36 agencies to provide therapeutic foster care. Our belief is that kids should be with families, not in a group home, congregate setting, PRTF, which is psychiatric residential treatment facilities. Preferably, they would be with their own family. If not, we try and get them connected to a therapeutic foster care. Over the years, particularly with COVID, the number of families interested in delivering this care has reduced. But we do have 135 therapeutic homes in Cumberland County, which provides 256 beds. We've also worked to develop 7 specialized therapeutic foster care beds. What makes them specialized, we pay a higher rate to give extra training and support. It is a true wraparound. We know these families can't do it alone without the additional support and the additional money to support these kids. Primarily, they serve kids with intellectual and developmental disabilities. Another group may serve kids involved in the Criminal Justice Resource Center. And I know we've talked about developing a psychiatric residential treatment, PRTF. That is a locked facility. I will tell you the evidence for those facilities is not good, but they are a place that we have used. I am working with the state on a solution to serving kids that are stuck in ED, stuck with Brenda over in DSS, and we're talking about finding ways to use the 300 vacant beds across the 3 state hospitals to put a provider in there and serve some of these kids. It's been a waste. The state hospital system has been set up to serve those with the greatest needs, and they've been unable to do so because of staffing, because of funding. So we're talking to them about, well, let's see if we can find a provider to come in and serve in that role. And that will also eliminate the need to build brick and mortar facilities and all of that, what comes with that. The facilities are there, the beds are there, we just need staff and someone to operate. Bridge housing, I think you may know about our bridge housing. We fund 12 12 beds for people coming out of the ED that are homeless. There's any referral source in the community can access one of those beds if there's a bed available. Typically, folks who are homeless or don't have permanent residence eventually end up at Roxy, which is the crisis facility, and then Roxy and our care managers help them access those beds. All right, crisis services. I'm sure you're familiar with Roxy. I still call it Roxy. I think it's called something else. What did I do? Oh, it didn't change there. Sorry. This has been a long-term partnership between Alliance and Cumberland County. The provider is RI. They've been operating it for a couple years. There's been a lag in getting the residential piece open. They are now open. The behavioral health urgent care piece, which is the 24-hour chairs, which is crisis stabilization. People come in, get assessed, and the 16 beds are now open as well. One of the other things we're doing is we've, over the past couple years, built 54 crisis group homes that are only available to youth. I don't need to get too much into this, but with the pending Blue Cross Blue Shield taking over to operate the Child and Family Specialty Plan, which will serve DSS kids, we need to figure out how to work with that. The last piece is around mobile crisis. Mobile crisis has really not been as effective as it should be in North Carolina, particularly in Cumberland. We have tried different ways to try and make mobile crisis work. If you're not familiar with mobile crisis, if somebody is in their home, they're in crisis, instead of them having to go someplace, tie up law enforcement, tie up EMS, tie up the EDs, mobile crisis can be dispatched and see the individual in crisis, try and provide some brief counseling, help hopefully get them stabilized, and so they can remain in their home. The last piece is MORS. MORS is a program. It's not operated statewide. We have targeted Cumberland to help set this program up. This is a program for, what did I do? Sorry. MORS is a program for youth. It is a mobile crisis service where the team goes out, meets with the individual in crisis. What's different about it than a traditional mobile crisis is there's a long-term stay after the service is provided. So case management is provided, making sure they get connected to needed services. All right, turn it over to Ms. Goodfellow.
All right, just a little bit about substance use disorder and opioid use disorder services. We currently contract with both opioid treatment programs, OTP, in the community. They're serving over 1,000 members annually. This is the highest rate of utilization in our entire catchment area, so that's great. People are getting treatment. We also contract with 4 intensive outpatient providers and 2 comprehensive outpatient providers. Originally, when we were speaking with the county about expansion of services, we explored long-term substance use disorder. The startup costs of this are extremely steep. There's also no sustainable funding for long-term care. In addition, the Medicaid service definition has been postponed at this time, and so we took this off the table. There are some privately owned facilities that are starting up in North Carolina, Wilmington, Raleigh, and one other location, Concord. And so we'll contract with those providers, and so our members can receive treatment. If they're Medicaid members, they can get transportation through our non-emergency medical transportation service. If they're uninsured members and they're coming out of the hospital, we can also provide that transportation. So to get into a little bit of the dollars, as I mentioned, our balance as of June 30th is a little under $9 million. In fiscal year 25, the county executed a clause in the funding agreement that allowed the fund balance to be used to fund the fiscal year 25 agreement. Note that the county dollars are the dollars last spent. So even in fiscal year 25, if we have state dollars available, we will not draw down that fund balance and touch those dollars. So that a little less than $9 million could still be the same amount as at the end of fiscal year 25. All right, to get into a little bit of the proposal. So we have 3 programs that we propose to the county. The first is specialized primary care. This is working with Cape Fear Valley Health to establish an integrated practice to provide both behavioral health and physical health services. We serve the majority Alliance members are currently seen across all the primary care settings, so it makes sense to provide this integrated care. It will make sure that our members get all their needs met. We identified $750,000 as sort of a one-time. We originally assumed a split between 50% between fiscal year 25 and fiscal year 26. We're still in discussions with Cape Fear, sharing data, looking at that scope of work, and so you may see some of that shift into fiscal year 26. Overall, that amount would not exceed $750,000. We also have a post-overdose response team. This is a team of licensed clinical social workers and peer support specialists working with EMS that provide outreach and follow-up to individuals treated by EMS for an overdose. It allows EMS to start medication-assisted treatment in the field with port following up to ensure members are connected to care. This also helps in ED diversion. This was previously funded through a grant that ended in October of 24. We provided a little stopgap money of about $179,000. $462,000 would be one time and would help get to the end of June, and then ongoing costs would be $693,000. Next, we have a jail liaison post-release program. There are a high number of individuals with mental health and SUD needs incarcerated in the local detention center. Right now, Alliance serves Alliance members only. There's a need to provide a greater level of services to these members. This program would establish a 3-person team, 2 master's level care managers, and a certified peer support specialist. This will help members coordinate with detention staff and jail health staff and allow individuals that need behavioral health care upon discharge to have that follow-up and that connection. Again, right now we only see Alliance members. The annual funding for this would be $292,000. And then also included the one-time annual funding agreed amount. So the next 2 slides, I'm going to go through 2 options. And the only difference between the 2 options is whether or not that fund balance is utilized to fund part of the annual funding agreement. Again, as we continue to have state dollars available, that lessens our reliance on the county dollars. So again, I'll go through those 2 options and go from there. So option 1 assumes that in fiscal year '26, the annual funding is funded from the fund balance. This again would assume that all our state dollars are utilized, and in order to provide funding for the crisis and outpatient services in Cumberland County, we would use those dollars. And so this really just reflects of a drawdown of those programs I just talked about in the previous slide through one-time or ongoing dollars. The short story is that by fiscal year '28, we would need additional dollars added to the funding agreement to be able to sustain those programs. Option 2 is a similar story. It just assumes that instead of using that accumulated fund balance to fund the annual funding agreement, you budget and allocate us an additional $4.8 million. And so you can see, again, the drawdown of those one-time and ongoing dollars really just takes this out a little bit further, that it would be fiscal year '32 before there would be a need to add to that annual funding agreement. I know we're really questions to the end, and I believe we can turn this over to Dr. Green.
All right, good afternoon, Commissioners.
Good afternoon.
So we have a couple of pieces of the proposal that were mentioned that we wanted to make sure you all were clear that these services are in alignment with our current activities going on in the county with the Cumberland Fayetteville Opioid Response Team, some of our upcoming sequential intercept mapping, and we're not duplicating a service, but we've been thoughtful about how to make sure those pieces work in alignment. Oh, no, I did the same thing, y'all. I have successfully operated. It's not. I pressed too many buttons. I've worked this computer many times. Okay. And there. Okay, I got it now. We mentioned this back in January. We came to you all about sequential intercept mapping, and we conducted that on January 30th in collaboration with Alliance. Alliance was one of our facilitators, Seafort, and many other partners. We had about 50 different partners that were in the room that day. And the goal of sequential intercept mapping is to identify gaps in services along the continuum where mental health and the criminal justice system interact. And that's where we often see people that end up in custody, whether it's with DSS or at the hospital or at the health department or needing a behavioral health provider. And so we identify resources in several different areas, including gaps in law enforcement, with our court system, in our jails, reentry. And these are just sort of some of the preliminary gaps that were identified in what we call Intercept Zero, which are our community-based services, and in the law enforcement section. So those things include, which will be no surprise to you, housing, the need for expanded mobile crisis. So Rob talked a little bit about mobile crisis, funding for Cumberland County EMS post-overdose response team, which you saw in the proposal. Crisis intervention training, ability to have co-responders, so not just a law enforcement officer responding to a call, but also having a professional individual that's licensed to help to respond to those calls and divert individuals away from the ED and away from being incarcerated, and then the need for additional crisis beds. So you can see already where the proposal aligns. And then in addition to that, Seafort has been working on our opioid settlement dollars and implementing those strategies. And so a couple of the projects that we're working on there align nicely with the funding proposal. So funding is supporting some of our treatment providers to provide wraparound recovery support services. And so there's a referral source back in both directions to both the treatment providers and then for them to get supportive services like housing and job placement. We opened the Recovery Resource Center back in October. We also are working on several community-based or early intervention projects that will help build capacity on the prevention side of the house.
And then one of the things that came up frequently in our sequential intercept mapping was CIT and the need to expand that service. We have CIT in our community, but there needs to be expansion of that program and those services. And so we are including this as an option B strategy. If you'll remember, we have option A strategies that we can sort of off the menu select those, and we're doing that. And then those option B strategies require approval from the state, and that we included CIT training in our option B strategy in our report to the state. So we're looking at some dollars to go towards, about $90,000 to go towards CIT training. Rob mentioned transportation being a challenge, so we're working on transportation for folks that need to go out of county. We talked about long-term care, treatment in long-term care facilities. Opioid settlement funds would support that transportation out of county if needed. And then, of course, we have that medication for opioid use disorder program at the detention center. So that program, that jail liaison position that was talked about, is really important here. So what we envision and imagine is that the health department's licensed clinical social worker and the detention center's peer support specialist would work very closely with the jail liaison to get people connected while they're in the detention center, and then make sure there's a hot handoff outside of the detention center. And then we have some federal dollars through SAMHSA and BJA that are allowing us to do some overdose intervention, overdose prevention education, and then also expanding the LEAD program. The Sequential Intercept Mapping Task Force is set to meet. They're actually having their first meeting on Monday to talk through more of these priorities. And the aim of this task force is to really think through the sequential intercept model, and then again, making sure we're keeping all of these programs and services in alignment so we're not working in silos. We are excited about the proposal that was presented because it will help us to fill in some gaps not supported by other funding sources. And so I'm going to turn it back over to Kelly.
So in a short summary, we proposed over $2 million in expansion of services, and ongoing funding would need to be made available at the earliest of fiscal year 28. I believe there then would be a selection of option, and as a part of that would be the approval of the programs. Happy to entertain any questions.
Commissioners, we'll open it up for questions. Vice Chairman, do you want to start, or do you want to defer?
Defer.
Commissioner Tyson?
Thank you, Mr. Chairman, and thank you for that comprehensive presentation. I appreciate Dr. Green being here and also providing some analysis. I think it's always good to have our social services and our health department here and as a seat of this conversation. One question I have, and maybe this is for our county manager, and I know it's real early, but in terms of budgetary impact between option 1 and option 2, based on the budget you plan to present the board, can you get a pine on that a little bit?
We can handle either one. Either one, option 1, option 2, I don't have a determination. I would just say that since we're using our fund balance, we'll probably be 2 years out before we have to fund them again.
Just to clarify that, though, in option 2, you're using funding, you're not using the fund balance. So we would be budgeting our annual amount in option 2.
It wouldn't have an impact.
Because you budgeted it last year, so I'm sure it's in the budget.
Yeah, it's in the budget, so
It would be a
wouldn't have an
savings in the
impact.
budget if we went and
Yeah,
cut.
if we use fund balance, it'll be a savings in the budget, either way.
Commissioners, other
Thank you,
questions?
Mr. Chairman.
I'm sorry, Paula.
Oh, no, thank you, Mr. Chairman.
Vice Chairman Jones?
Thank you, Mr. Chairman. Yes, I did have a question. I know that here in North Carolina, a lot of the jail-based mental health services are provided through a variety of programs and services, such as the FIT program, which is the formerly incarcerated transition program, and also No Doubt Rise program. So I guess my question is, there's a great need, no doubt, and you all do referral services, with there being a great need of that in itself, what exactly, if you can go into a little bit about that, for instance, for example, I know that Fit Wellness specifically, they are for individuals with severe mental illnesses that are released from the state prisons, and then that's in Wake County. You all are probably familiar with that. But I would like to know for here in Cumberland County, what are some of the resources that are provided that we're trying to do for those that are incarcerated? That would be similar to the FIT program. And for those that aren't familiar with that, the FIT program is basically, it's a program that's put in place in Wake County that's called a formerly incarcerated transition program. So I'd like to know what are some things going on that Alliance is doing for our, particular inmates that are in jail that have mental health needs, and what type of resources are being provided for them for when they get out for transition.
Commissioner, I'm going to have to get back on more details. I do know we are involved in treatment. We do some substance use treatment in there. I know we have liaisons who help make sure that they're connected back to care in the community, but all the programs, I'm going to have to get back to you with that.
I think Dr. Green can also provide some information.
Okay.
I thought you were trying to sneak out, Dr.
I tried. So that, Commissioner Jones, I think some of that is touched on with the peer support specialist that's in the detention center and our licensed clinical social worker. So they work to, before an individual gets discharged, make sure they are, for example, if they have a treatment provider while they're incarcerated, then when they exit, making sure there's a warm handoff to the person outside, making sure they have naloxone, making sure they have a connection back to the Recovery Resource Center, making sure they have, whether it's connecting back with the reentry. So that's part of the role of both of those individuals, is to set that person up for a success when they exit. The gap that is going to be filled here is the two staff that are working there now really don't have the ability and capacity to serve outside of the detention center. They make warm and hot handoffs as they can, but that jail liaison position that they're talking about really is going to be able to help have a stronger team to be able to follow up on those resources out in the community. So they sort of get the initial little look and planning and discharge planning with WellPath while they're incarcerated, and then they'll have that good follow-up on the outside afterwards.
Okay.
And I'm not as familiar with the Wake County program, so I'm not sure if that's where you were thinking in your, about how those two things align.
I was, because hopefully, and we love Cumberland County, I'm hoping that we can also maybe later see about putting some programs in place for that. One more question, speaking of that, because I do know that there are several individuals that are incarcerated that they have mental illnesses, they cannot stay on trial, and therefore, when they regain their competency to participate in court proceedings, I guess my question would be, does Alliance have something in place for those individuals? Again, if you are not competent enough to stand trial because of your mental illness situations, do we have anything in place in Cumberland County to where those individuals are being, I know there's no longer a Dorothea Dix, but do we have any place or anything in place to where those individuals are able to go or have referrals to?
So I can maybe start. And so, for example, the licensed clinical social worker that I talked about, that person will go to court and sit and at least listen and hear. Mm-hmm. And then there's programs like the law enforcement assisted diversion program that they encounter individuals. They also have staff that go to court. There's a couple of different community partners that have a presence in the court system that can help and assist and be a supportive. Is it at full capacity? I don't think anybody would say that. And then there's, as we've talked about the SIM task force, there's some conversations about how we can better coordinate with justice services and all of the court coordinators to make sure that there's everybody is familiar with the resources and we're making those connection points back. And if you
I'm sorry, and one more question now. But as of current, though, we don't have an actually specific facility. I guess that's what I'm getting at. Like, say if you're a non-violent individual who committed a crime, but you have addressed, serious mental illnesses. Since now that Dorothea Dix is closed, there is not like a referral place for them, or is there? I would like to know for people to actually go and live and stay here in Cumberland County.
Well, it would be one of the 3 state hospitals has programs for those. That sometimes they're full and access can be challenging, but the state hospitals is primarily geared to
But none in Cumberland County.
None in Cumberland County that I'm aware of.
Thank you.
Sure.
Other questions, commissioners? Robin, this is probably for you, or maybe Kelly.
Or Dr. Green.
No, Dr. Green will not want to take this question. In our past experience, you're going to want to field this one.
All right.
So, and this is more tried forward-looking, so we know there's a lot of movement around Medicaid right now. If the trigger laws are affected in our state, what's that impact, and how does that impact what we're talking about today? Because now we're going back to a system pre-expansion, which looks very different than what we're doing today. So what are our contingency plans, and what are we looking, and I know you're keeping your ear to the ground, so are we. But how are we preparing contingencies for that?
And when you say trigger laws, that means if the federal government, so how Medicaid is funded in North Carolina, we get a contribution from the federal government. I think it's at 90% now. There's 10% paid by the states. Right now, that 10% is paid by the hospitals and health systems to fund that 10%. North Carolina put a law in place based on what's happening at the federal government. If the FMAP is what the federal government contributes to Medicaid, if that is reduced by 1%, that means that Medicaid expansion, all 632,000 of those folks, they now have access to a payer under Medicaid, will lose Medicaid, and they will be reverted back to uninsured, underinsured. That the analysis, as I understand it, just going from 90% payment from the feds down to 89% payment from the feds is about $160 million statewide. It would be devastating, and I'm glad you brought that up, and we're really worried about that. Ear to the ground. It really, I can't imagine that taking place, but what do I know? It is so devastating. There's been so much pushback. We've been pushing back. There's a whole bunch of advocacy groups pushing back. But that is definitely something we can't have happen in our state.
And I understand that we can't have it happen. I guess my question is as we look forward to continue to be proactive, what contingencies are we beginning to look at to put in place?
Yep. So what we would do is we would take our state dollars and then change what we've done to improve and expand care. So we've raised provider rates using state dollars. We've increased benefits. And what that means is before expansion, we can only afford to fund 4 hours of outpatient. We're now funding you 12 hours of outpatient, right? Because the money's been freed up. We would have to revert back and probably cut some new programs that we've developed to support the uninsured.
I guess I just want to make sure we're thinking through that, because I know there's a lot of effort around it, but I think we need to look at a stark reality that could potentially happen.
Could happen.
And I think it could happen in phases based on the tea leaves that I'm reading.
We did receive some funding cuts this week from the ARPA dollars. That has impacted, we get about $8 million of ARPA dollars from the feds through to state, down to us to manage. We've got several programs that we're concerned about. The state is trying to find money in their coffers to give to us to be able to continue some of those programs. Some of those programs will definitely be on the chopping block. We are also looking internal. We know there's some critical services in place that we want to continue to fund. So the funding cuts have started. We haven't felt the heat completely yet, but we'll see.
Just to provide additional commentary around the local dollars, we have agreements with several counties in our region for local dollars. And as we've spoken today, we have those dollars and the accumulation of that fund balance, and Cumberland County is not alone in that. And so initially, some of that pressure may be put back into those local dollars and again, draw that fund balance down. If for some reason we had a huge shift from Medicaid to state dollars and had to utilize our state dollars at a greater level or sort of up to the funding level, we would just be able to utilize those accumulated county dollars. So it would not be an immediate issue. It would just may result in, fiscal year 27 or 28 being able to fully fund that funding agreement. Hope that helps.
I understand. I just know there's around Medicaid and the expansion, there's a lot of conditions, whether it's work requirements or funding, and there's a lot of components, especially here in North Carolina. There was a lot of compromises made around this legislation. So I would ask that we stay connected with our staff so that we can be nimble while we have a fund balance. Depending on which option we pick, we're going to be burning that fund balance down. So, any other questions, commissioners? If not, I would entertain a motion. Vice Chairman.
Motion to, I recommend approval of the Alliance Health Service Expansion Proposal, Option 1, and move this item to the Board of Commissioners consent agenda for the meeting on April 21st, 2025.
Is there a second?
Second.
Don't second it if you're going to abstain. All right, there's been a motion on the floor to approve the Alliance Health Service Expansion Proposal Option 1, move it forward to the consent agenda on April 21st. Any discussion on that item? Hearing none, I would ask for your vote. All in favor, raise your right hand.
Unanimous.
Okay, thank you so much. Thank you for your time.
Thank you.
We'll go ahead and move to item B, Cumberland County Strategic Plan.
Yes,
County Manager.
on January 30th and 31st, you all, the Board of Commissioners, had the strategic plan. It was conducted by Rebecca Jackson, CEO of the True Performance Group, and Chris Ray, head of RC Strategies. She's going to do a presentation of the results of the retreat and go over the strategic plans and answer any questions you may have.
Great.
If we get her set up.
That one.
We're supposed to have somebody join virtually. I think so.
Ms. Jackson, you want to go ahead and introduce yourself or do anything while we're trying to get this up?
Sure, will do. Good afternoon.
We all have paper copies.
All right, thank you for the opportunity to come before you today. My name is Rebecca Jackson. I'm CEO of True North Performance Group, which specializes in local government excellence. I am joined, I believe, by Mr. Chris Ray of RC Strategies in this collaboration effort. Is he online? Not yet? Okay, he'll be coming shortly. So as he pulls it up, I'd like to say, imagine a future where every Cumberland County resident, every child, young adult, elder, with any living ability is thriving. Imagine that not just as a vision, but as a reality. Mm-hmm. As a reality. And then are we doing, sorry, let me make sure. I'm pressing down, like you said.
I love this right here. It's one of my favorites.
You good? Yeah. So that's what strategic planning is really designed to achieve. We're good? Just press down? Okay, great.
Bigger.
We need to put it in review mode.
Yeah, but thank you.
Yeah, this is off a little.
Yeah, thank you.
Sorry. So over the past few months, as they get the technology going, I'm just going to continue with my comments, if that's okay.
That's wonderful.
The board, great. Over the past few months, we've worked together to gather insight from our stakeholders. We analyzed our strengths and our challenges. We examined environmental trends. And so the draft strategic plan that you have before you, and I believe we do have handouts at your dais, this draft plan reflects the work. It's your best thinking. And today is really about looking at it and refining it to ensure that it truly sets us up for success. The strategic plan, again, it's not just a document, and we talked about this during your retreat, right? It's a roadmap shaped by all of you during your retreat. We had rich discussions, thoughtful contributions, and tough questions along the way, we're good? All right, so as we dive into the strategic plan, I want to bring us back to what really united us through your retreat. It's your mission and your values, right? This strategic plan should be a reflection, thanks guys, of your core principles. So as we review today, I want to encourage and ask you, does this plan truly guide you toward fulfilling your mission? So we're at a pivotal moment, and the challenges and opportunities ahead for Cumberland County require us to be clear and intentional about where we are headed. The draft strategic plan is our first collaborative and collective step in that direction. So today, let's talk about how it captures our priorities and where we might refine it together. So during our time, we're going to briefly discuss the importance of creating that strategic plan and the structured process that actually brought us to this point today. We're going to then review the draft plan, which integrates all of the key components that we're going to talk about. This includes what we referred to during the retreat as long-term foundation of the plan, so the vision, the mission, and the core values. From there, we're going to take a deeper dive into the strategic planning areas, examining the goals, objectives, and strategic initiatives that guide the county's future. So today our focus, again, is going to be on building consensus and securing approval. We're prepared to make any adjustments to the plan that the board deems necessary, and then following this review, we're going to bring it back to staff, who will bring it back to you for formal adoption on the next consent agenda. So I assure you we're going to move through this material pretty effectively, but I also want to express my gratitude to the Board of Commissioners, staff, and the community for their time and investment in this particular process, because the commitment is essential as we transition from planning to implementation. So what is the purpose of strategic planning? And we're going to cover that real briefly first. Strategic planning can be illustrated with the story of Alice in Wonderland. Alice, if you remember, falls down the hole, as many of us do from time to time, and she meets the Cheshire Cat. And she asks the cat, what did she ask? Which way should she go, right? And instead of telling her a direction, he said, well, that depends a good deal on where you want to get to. So in other words, any road is going to get you there if you don't know where you're going. It was up to Alice to decide where she really wanted to be first before setting off in a direction. Strategic planning is just like that. It is centered in visioning, knowing where you want to be in the future, what outcomes you hope to see in your future. And in this rapid response world, it can really be difficult, and I know it was for the county, to think 10 years or 5 years, even 5 years out. Some strategic plans reach out long-term, especially crafting that vision statement. Long-term planning is a comprehensive framework that is comprised of goals to be met within a certain period of time, right? Like 3, 5, 10 years. Short-term planning evaluates your progress in the present and creates an action plan to improve performance, typically in the 12 to 18-month period. And you're going to see those stepping stones in your plan today. It's important also to understand the basic strategic planning framework that we have incorporated into the strategic plan. The definitions and terminology are important. Organizations sometimes use these terms differently, so let's briefly review just what's typically included in a strategic plan. So if you'll notice on your screen, you've got a pink circle and a triangle. The blue triangle starts with your vision and your mission. Your vision statement should answer the question, what do we want our community to be like for future generations because of the work that you're doing now in the county? The mission statement should answer the question, what is our organizational purpose and what is our existence? What's our role in getting there? Your core values here are represented in that pink circle all around, surrounding the plan, and it should answer the question, what are our beliefs and attitudes that guide our behavior and our relationship with others? The strategy back in the blue triangle is where we look to answer the questions, what are our strategic planning priority areas, our goals, and objectives. What are our priorities? What are our targets? And finally, how do we move the needle in the shorter term, those strategic actions in the next 12 to 18 months? And which key performance indicators are meaningful, and how are we going to track our progress? It's important for us all to recognize the benefits and uses of a strategic plan. These plans are not meant to sit on a shelf. In fact, these strategic plans should be reviewed annually so that they can contribute meaningfully and be used to provide strategic direction to the organization. If properly assimilated into the culture, strategic plans will be the basis for your budget development. So let's make sure that those things happen. They will help you align the organization structurally and develop consistent processes. Strategic plans should be the basis of your performance management plan for the organization and serve to provide support for employee and residential engagement. And it also should incorporate resident and priority satisfaction levels. So this graphic is an example of a strategic plan hard at work aligning the organization for success. The strategic plan is developed and adopted by the elected officials. The plan should then be used to inform the annual budget, capital, and technology plans. Once resources are allocated to the prioritized programs, the plan is executed by staff and the performance results are managed and reported to the public. There's also a focus on performance improvement. Feedback is provided from the workforce and residents to adjust the plan annually. Cumberland County championed this effort to lead the community forward with a strategic plan aimed at creating a positive impact for the community. This slide shows the graphic with several lines of effort. You'll see all of that, the different colors coming together, advancing from all the different angles to converge on a single line, and that is the path to hit the target. So what's the target, right? We can use this graphic to illustrate what a strategic plan can do for local government with so many processes and services that combine together in a single focus, the community. Positive community impact is the red bullseye on this target. Strategic planning allows us the opportunity to hear from our employees and residents and to prioritize those needs. Understanding the results we want to achieve and having a clear focus is foundational for building a culture of high performance that you want here in Cumberland County. So let's talk a little bit about our strategic planning process here at the county and how we got here. You, your staff, and your community and the board have been really hard at work. In December, we kicked off the effort with planning meetings. In January, the Board of Commissioners held a 2-day retreat where we talked about, we reviewed the key successes, we held a community input session, conducted an environmental scan, examined internal and external trends that shaped the county, created a historical timeline. If you remember that, you engaged in some visioning exercises, and then we discussed the county's purpose and mission, and then we really focused heavily on developing those strategic planning or strategic priority areas, So during the retreat, the board confirmed the vision statement, mission statement, core values, and defined those strategic priority areas. So you'll see some of the information here. It talks about the goals, objectives, and strategic initiatives and how they are defined. And so what's next? What are we going to do next? Today we're going to present the full strategic plan for your review and approval. And if approved, you're going to have a formal adoption, as I've mentioned. Later in April, staff will hold a workshop to help align this plan to their business plans, their departmental business plans. And then beyond April, the real work will begin, right? What's the real work? We talked about it. It was a big takeaway from the retreat: implementation, execution. So that includes finalizing all the action plans that are contained within this strategic plan and regularly reporting progress so that it helps guide those policy decisions. All right, we're ready? Let's start by looking at the vision statement. A county's governmental vision statement is concise, aspirational declaration that really defines the future state of the community as envisioned by its governing body. So again, reflecting those goals, core values, and all the aspirations. A well-crafted vision statement is a beacon, right? It fosters that growth. So as a part of this process, the board during their retreat created a historical timeline. So we took We looked at those pivotal events and moments in Cumberland County history. You did a visioning exercise where we actually talked about what Cumberland County looks like in the future as you wrote those postcards to yourselves, if you remember. And then we crafted a vision board. So from that vision board, there were several different themes that came to fruition. One was economic prosperity for all. There was public safety and resilience, workforce housing, an inclusive military and civilian community, regional leadership, a healthy community, and a world-class education system. So bringing these all together, this was the draft vision statement for your review today. Cumberland County is a regional leader in economic prosperity and community well-being. We are safe, resilient, and inclusive community where military and civilian life thrive together. Housing is accessible, and a high-quality education empowers all. Through collaboration and service, we build a strong, healthy, and prosperous future for everyone who calls Cumberland County home. Okay? Now, I know that this slide is crazy, right? Lots of words. We included it because we wanted all the framework from your strategic plan in your packet. I'm not going to read every word, but emerging from that vision work were some defining statements that we're going to call pillars of the future. It helps really to further articulate that vision statement that we just read to the organization and community. These can be talking points, if you will, about your vision, right? So these pillars are talk about being a leader in economic prosperity, about what it really means to be a community committed to well-being, safe and secure, being resilient and forward-thinking, being an inclusive and welcoming community, being a thriving military and civilian community, having accessible and diverse housing, being committed to high-quality education, and finally, having that culture of collaboration. So lots of words, talking points for you to use when you're out talking about what your vision means for you. All right, moving on to the mission statement, if it pleases the board. Okay, so let's turn to Cumberland County's mission. This is your organizational role in pursuing the vision you just crafted. It's the heart, and the heart of this particular mission statement is serving, leading, and thriving. 3 words. But they're more than just 3 words. They are your organizational mantra. It should guide the Board of Commissioners, county employees, and all the boards and committees in their daily work and decision making. Serving the community with integrity and dedication, leading with innovation, accountability, and vision, and thriving by fostering growth, resilience, and an opportunity for all. So I'm going to read the full mission statement. It is as follows. We are committed to delivering high-quality, innovative, and fiscally responsible services that enhance the well-being of individuals, families, businesses, and the broader community. Through visionary leadership and strategic investment, we create an environment where every resident has the opportunity to reach their full potential. As dedicated stewards of our county's resources, we foster economic growth, public safety, and community engagement, ensuring a strong and prosperous future for all who call Cumberland County home. Okay, moving on to the core value statement. During our work in the retreat with the board, we reaffirmed Cumberland County's core values. So during the retreat, you had the opportunity to look at these. We talked about the behaviors during the exercise, the aspirations that you have regarding this particular core value statement, and it was affirmed. And Cumberland County's serve citizen with pride. That is the core value statement. And what pride stands for is professionalism, right? Upholding the highest standards in service and conduct, respect, fostering that culture of inclusion and dignity, integrity with accountability, acting with honesty, diversity, embracing and celebrating the strength of our differences, and excellent customer service, delivering responsive, high-quality service to all. So embracing all of these, the county remains committed to that pride. All right, so I'm going to move on to the strategic priority areas. Lots of reading, but I think it's important that we move through that. I'll do it very quickly. So if you have any questions, if you wouldn't mind waiting until let's pause at the end of each strategic priority area, if we will. All right? Strategic priority area, here's your definition. It is a 3-year critical focus within an organizational strategic plan that is essential for achieving its mission, vision, and long-term goals. All right? So if you take a look at this slide, this further defines what that strategic priority area looks like. It's kind of like an accordion. So if you open that strategic priority area up, you're going to find that you have goals and objectives, which are going to get you clear targets and drive progress. You're going to have key performance measures indicated within that, and that's going to help you track success. And then you also have strategic initiatives, which were those actionable projects, those 12 to 18-month actionable projects that's going to create the impact that you hope to achieve. Everybody with me? All right. So drum roll. The board identified 7 strategic priority areas. We tried to squeeze it down to 5 or 4, but 7 it is, and we love them because you're going to see the richness of the impact that the county has on the community. So here are the 7 strategic priority areas. The first one is enhancing health and wellness. The second one is ensuring a safe community for all residents. Third is fostering economic prosperity. 4, encouraging quality development and smart growth. 5, championing responsive, transparent government. 6, providing cultural and recreation opportunities. And 7, supporting a high-performing education system. So each of these 7 priority areas, again, are going to have goals, objectives, key performance indicators, and strategic initiatives. So let's take a look at them now. All right, this is the first one. And by the way, these are not in priority order. I just numbered them just so that I had a way of calling them out to you, and so that when we discuss it, we have a way of referring back to them. That's maybe some work you would do in the following year, but this is just, I just wanted to make sure everybody was aware it was not priority order. All right, so starting with the first SPA, and I'm going to simply read through them for prosperity, if that makes sense, and stop me if you have questions, unless you want to do it differently. All right, so enhancing health and wellness. Let's take a look. Goal 1, reduce abuse and neglect. So some objectives and key performance indicators, and I will refer to them here on out as KPIs. There are a few. Decrease elder and disabled and child abuse rates, decrease the number of children placed in foster care, decrease substance abuse rates, increase the number of pet adoptions and live releases at the animal shelter. Goal 2, improve food and nutrition health. Objectives and KPIs are to decrease the percent of households lacking consistent access to sufficient food, reduce rates of obesity, diabetes, and other diet-related conditions, and increase the average percent of public health clients seen across all clinics. Goal 3, strengthen physical and mental health infrastructure, and those objectives and KPIs include reduce contamination in water, soil, and wastewater, increase the amount of information disseminated into the community related to contaminated water, soil, and wastewater, reduce infant mortality rates, increase the number of OBGYNs to improve maternal health care for Cumberland County, decrease the population of unhoused, and decrease STIs, STD rates, and teen pregnancy. All right, for goal 1, the list of strategic initiatives. These are the projects moving the needle. Number 1, continue and complete the maternal mortality initiative to address social determinants of health and improve access to high-quality care during and after pregnancy to prevent maternal mortality and morbidity. I said that right. 2, develop a detailed long-term strategy to ensure the reliable delivery of clean drinking water and effective wastewater management. 3, establish international farmers market with executed sustainable long-term production of local suppliers. 4, provide public awareness and resources in soil contamination for the agricultural community. 5, complete the unhoused support center to reduce homelessness. 6, develop a county-wide comprehensive plan to address clean, safe water and sewer. All right, so that is your first strategic priority area, enhancing health and wellness. Okay? Yes, ma'am. Questions?
Thank you. Actually, it's not a question, but I did receive a message that Mr. Chris Ray, the CEO of this RC strategy, he's been listening for the last 15 minutes. He's at the airport, but he is participating.
Okay, great, thank you.
You're welcome.
All right, 2. Hi, Chris. You're there. All right. Okay, so strategic priority area number 2, ensuring a safe community for all residents. All right, we have one goal is to enhance public safety. So your objectives and KPIs here are to reduce violent and property crime rates and gun violence, answer 99% of calls to the 911 call center within the first 10 seconds, increase the percent of responses handled as a health issue rather than a criminal matter for residents with substance abuse use disorder who are in crisis. And the next one is to reduce staff vacancies and turnover rates. All right. Under this strategic priority area, you have several strategic initiatives, and they are seek additional grant opportunities for at-risk youth programs, implement a digital dispatch system, study, assess, and develop a strategy for how the county is responding to mental health opioid response, establishing additional partnerships for crisis response, tackling performance data and tracking, performance data and targets. 4, establish a joint communication center. And 5, develop and implement strategies to support recruitment and hiring of sheriff deputies and detention officers. I think you have several items to talk about even today regarding that. All right. Are we good with number 2? Moving on. Any questions for 2?
We are, Ms. Jackson, if you want, if it makes it easier just from a time, if you just want to address the goal and then
Perfect.
we can review the KPIs on the screen.
Perfect. That's wonderful. Thank you. Happy to do it, but thank you. So the strategic priority area number 3, fostering economic prosperity. So let's take a look at those goals. Diversify the tax base. You'll see the objectives and KPIs. Goal 2 is to elevate to a Tier 3 county. And there's some goals and objectives and KPIs underneath of there. Goal 3, market and brand the community. Goal 4, strengthen workforce development. Your strategic initiatives for those are to examine and analyze county data quarterly to assess county's movement from Tier 1 to Tier 2, and then eventually the Tier 3 as in the target. Develop a comprehensive review of the regulation process with a review of all policy and procedures and identify those customer service improvements with a tracking mechanism to report results. 3, measure lost opportunities with data and information. And 4, create technical assistant pathways with State Commerce Department. All right, that is your strategic priority area number 3. Okay, number 4, your strategic priority area, encouraging quality development and smart growth. So your goals are to strengthen waste infrastructure. Goal 2 is to have effective planning and zoning. Goal 3 is to enhance transportation and connectivity. And goal 4 is to strengthen inspections and permitting. All right, moving on to strategic priority area, strategic initiatives. So that's going to be 7 of them. I'm going to list them. Expand the existing landfill facilities and implement programs to increase capacity and reduce landfill waste. Revise zoning codes to allow higher density residential development. Create incentives for developers to build workforce and affordable housing units. Expand broadband infrastructure to underserved areas of the county. Improve public transportation routes connecting residential areas to employment centers and community resources. Implement a stakeholder feedback mechanism at all stages of the development process and make necessary improvements. And then to create a one-stop shop permitting center for residents and developers to increase efficiencies and customer feedback ratings. Okay. SPA number 5 is championing responsive, transparent government. So we have 4 goals there. 1 is to ensure fiscal responsibility, build and engage workforce, strengthen in intergovernmental engagement, and 4 is to enhance communication. The strategic initiatives listed there are 8 of them. monitor and analyze all county compensation to develop strategy commensurate with peer counties, improve the process for county employee performance review and monitor the results, increase operational improvement projects, review process for child care options for employees, upgrade county website to be more user-friendly and modern, continue collaborative work with the Board of Education to ensure proper software database is implemented to help with precinct official training. 7 is to implement the ACFR, and 8 is to ensure communication of the strategic plan to the community. All right. 6 is to provide culture and recreational opportunities. That's another strategic priority area. Your goals are to support the arts and tourism, enhance community amenities, and ensure inclusive community activity and events. Your strategic initiatives, there are 7. To create an aquatic center development plan, create a children's museum development plan, enhance parks and recreation interlocal agreement to ensure all county communities have adequate accessibility to recreational facilities and services, establish partnerships with diverse cultural organizations and faith-based organizations. All right, finally, 7. Support a high-performing education. Support a high-performing education. So your goals there are to improve infrastructure, enhance teacher compensation, and expand early childhood education. Your strategic initiatives are to continue engagement with the school board on teacher supplemental policy and provide sustainable funding mechanism, to collaborate with the school board on developing a comprehensive infrastructure plan addressing aging facilities with clear timelines and funding sources. 3 is to strengthen partnerships with the Partnership for Children, organization to identify crucial needs and provide targeted resources to special needs pre-K programs. And 4 is to develop metrics to track educational outcomes and facility improvements. Okay. That was a mouthful, but I got through it. Everybody good?
I tried to help you.
Yes, thank you. We would have been here a little bit longer.
So if we can, Ms. Jackson, we can pause if there's any
I will.
questions on any of the section, the SPA, the strategic priority areas that we've covered. I think it captured everything that we have done or discussed. Hearing none, we'll look at next steps.
All right, so let's talk about next steps. What are we doing? So we plan to take input, refine that strategic plan if needed, but then certainly move this forward. If it's approved today, I think the idea is to move it forward as a formal document for a consent agenda at your next regular board meeting. And then the hard work begins, right? You're taking this plan and you're going to implement that plan. You're going to execute it. So part of that is going to be making sure that this plan is integrated within your budgeting and planning processes for your staff and departments, and aligning this plan with their departmental business plans. That's really where that hard work is going to come into play. Once the plan has been resourced and aligned, then action steps need to be taken to implement that plan, and then the county really should determine at what stage you will want to come back and report on the progress of the plan. So you might want to consider like semi-annually or annually at first, but certainly commit to that performance report. And then in closing, I just would like to congratulate the board and Cumberland County, and the work here is just incredible. Remind you that this is a living document and that you want to just keep on improving and refining this plan. And also on behalf of Mr. Chris Ray, who is listening from afar, and myself, I'd like to thank you for the opportunity to work with this great board and your staff.
Commissioners, I'll open it up for any further comments or questions before I entertain a motion.
I have a comment.
Go ahead, Vice Chairman.
Thank you, Mr. Chairman. I just want to thank you for bringing some excitement. I feel you were very professional, yourself and Mr. Ray, and definitely after, we haven't had one of these in 3 years as far as our strategic planning strategy, and it was just a pleasure. You all helped us get focused and move in the right direction, so just want to commend yourself and Mr. Ray again on bringing that energy that I feel we needed to recharge and redirect us for 2025, and you both did a good job in helping us move forward. That's
My
the only
pleasure, ma'am.
comment that I
Thank you.
have. It's a pleasure.
Commissioners, anybody else? Hearing none, I will entertain a motion from Vice Chairwoman Jones.
Yes, I recommend that we approve with all changes noted on the county strategic plan and move this item to the Board of Commissioners consent agenda for the meeting on April 21st, 2025.
Second.
So a motion to approve the strategic plan as presented and move it forward for final approval on the consent agenda on the 21st of April. Properly seconded. Any further discussion? Discussion? You ready to vote? Commissioner Fairclough. All in favor, raise your right hand.
Unanimous.
Ms. Jackson, thank you so much. Mr. Ray, thank you so much for your work, and we'll work on the implementation phase next after this is approved. Thank you. We'll go ahead and move
You all,
to...
congratulations.
Thank you, sir. We'll go ahead and move to item C, cost comparison of 4 and 6 year reevaluation. County Manager Greer.
Yes, when Tax Administrator Joe Utley presented the results of the revaluation, it was requested that we bring back what it would cost to move the revaluation process to a 4 and 6 year increment. Joe is going to do a presentation to provide that cost and ask for feedback from the board regarding this matter. Go ahead, Joe.
Good afternoon, Mr. Utley.
Good afternoon, Mr. Chairman and members of the Board of Commissioners. This afternoon, I wanted to provide a brief presentation about the cost of a shortened revaluation cycle, and more specifically, a 4-year versus 6-year cycle. The presentation is for information purposes. I also wanted to share with you the projected annual cost and the advantages and disadvantages of a shortened cycle. And then finally, I will provide a conclusion and my recommendations. So this is the overview that I just kind of went through of what we want to talk about today. We will kind of jump right in and start talking about the projected cost for a shortened cycle. The cost of the 2025 revaluation is approximately $4.3 million. We do track that each year through the what they call the AB8 form that we send to the Department of Revenue. That is the annual report of octennial reappraisal budget reserve. And each year we complete that. We update that with actual numbers. This is a projected number because we have not got FY25 actual spending in. So this is what we will spend approximately for the 25 reevaluation, which was an 8-year cycle. So when that's annualized, you're looking at approximately $535,000 a year. If you look at that same cost, because that cost should not change, the cost based on what the revaluation that we currently did. So the annualized at 6 years is $713,000 per year, and the 4-year cycle is annualized at a little over $1 million per year. And this cost that we use for the ABA, basically looks at our 5 permanent full-time staff that we have in the revaluation budget. The appraisal office has our regular budget, and we have the reval budget. So this is talking strictly about the reval. It includes the 5 full-time staff and their salaries. It includes any additional staff that we needed to conduct the revaluation. It looked at overtime. It looked at print services and postage. It looked at training and travel and any kind of software enhancements that were needed. So this is kind of like, this is to me is the baseline. With the current staff, this is what it would cost to do a revaluation. So if that is shortened, if our cycle is shortened to 4 years, then I feel like that there is going to have to be, and we'll cover that in a little bit, additional staff. So there will be an annual salary increase for a 4-year cycle of $707,000 per year. The other figures that you see there, there'll have to be additional vehicles and office equipment, additional contracted services, subscriptions and memberships, and training and travel costs. And all that we will have to have additional to help support the additional staff. The figures here that you are looking at, these are not annual. these are not an annual figure, these are for the entire cycle. So we'll break it down more into an annual in a little bit, but I want to just show that salaries are annual, and this is the additional amount that would be needed for that cycle. For the 6-year cycle, the salary increase, we would not need as much additional staffing, so the salary increase per year would be less. And again, all of these numbers for these 4 categories would be less because there's going to be less additional staff, therefore would be less additional vehicles needed, subscriptions and memberships, those things would be less. So to kind of to summarize that and do a projected annual cost, this is what I arrived at. Again, 4-year versus a 6-year cycle. You have that annualized cost that we looked at a while ago on one of the first slides. That for 4-year, the baseline is $1,070,000. For 6-year, it's $713,000. There's going to be additional costs in staffing and vehicles and the other items that I talked about, office equipment and so forth. So for an additional cost per year is $835,000. So the annual cost for a 4-year cycle is $1.9 million, whereas the 6-year cycle it's a little less than $1.2 million. So to look at a few advantages and disadvantages, a shorter cycle will equalize the tax burden more frequently, and I feel like that is fair to property owners. More frequently, revaluations will allow for a better understanding, better education of the public so that they understand the process. Theoretically, there would be smaller value changes over a shorter cycle, smaller increases, and therefore fewer appeals, but that may not always be the case. It's still going to be based on the number of appeals will be related to the percent increase. We will be able to review market areas more often, make sure our data is up to date. Recent sales will be more relevant with the for valuation and appeals because of the shorter cycle. You're only allowed to use sales during that cycle, so shorter cycle would mean more current sales, even though we try to do that also even with an 8-year cycle. It provides more flexibility. If you're wanting to do a 4 or 6-year cycle and you feel like you need another year to complete it, you can always adjust it. We can go up to, again, up to an 8. But if you're at an 8-year cycle, you can't go up to a 9 unless there was some kind of major catastrophe. A shortened cycle, and I think this is important, a shortened cycle lessens the chance of a revaluation being mandated by the statutes. Statute 105-286 now states that the sales ratio falls outside of the range of 0.85 to 1.15. The Department of Revenue can mandate that you do a revaluation within 3 years of the date of that notice. So a shorter cycle lessens the chance that you have to do a mandated revaluation. And it also avoids a 4th or 7th year public service value equalization. The tax office does not determine the values for public service companies. The Department of Revenue gives us those values. They use a equalization method to provide those values. If at any time in the 4th year or the 7th year our sales ratio drops below 90%, then they will do further weighting of that value, and our values or our public services companies will drop. And that has happened, this revaluation, I believe, in the last 2, if not 3 years, where the public service company values dropped. So disadvantages is the annualized cost is considerably higher for the shortened cycle versus an 8-year. Should values appreciate, taxpayers may see the accelerated schedule as the county take an opportunity to raise revenue. If the values decrease, then money would be spent on a revaluation that may have a net loss in value like we had in 2017. And that could end up resulting in having to possibly do a tax increase. So there are some disadvantages there. We will need an additional staff to do a full-time, have a full-time revaluation team with a shorter cycle. We'll have to have additional office space, cubicles, computers, software, and so forth. Additional vehicles will be needed under a shortened cycle. Additional cost of education and continuing education, as our appraisers have to be certified by the Department of Revenue and have to maintain continuing education hours. And at any time with our software, we need enhancements. A shorter cycle just gives us less of an opportunity to put that in place. So in conclusion, I would say that with the staff that we have now, they have concluded the revaluation of our new tax software system. So there is the expertise within our staff to do a shortened cycle. However, because the staff experience is going to drop. Right now, we have our two most senior people have 24 and 25 years and have been through 4 revaluations. Everybody else on staff, this is their first one. So a shorter cycle. Our experience level definitely drops, which will make that a little more critical. We do need a specialized revaluation team with either way, whether it's 4 or 6. Additional staff will need to be hired. I have looked at the hiring, looked at the staffing levels. We would need 10 for the 4-year, 8 full-time, and 2 part-time, and for a 5 or a 6-year would be 4 full-time and 1 part-time. Space is a concern with cubicle space. Here with the staffing that I predicted, I believe that we could fit that staff into where we have the space we have now, but with a 4-year, when we needed 8 to 10 people, we do not have the staff in the tax office currently. Staff, we do not have the space for the staff here currently in the tax office. Additional vehicles and other costs is going to be higher the shorter the cycle. And when looking at the 4-year versus a 6-year cycle, I've predicted that the cost would approximately be $745,000 a year more to go to a 4 versus a 6. Based on this and the numbers calculated, it would be my recommendation that we would transition to a 6-year cycle at this time and conduct the next revaluation in January 1 of 2031, and then follow that up with a 4-year cycle thereafter in 2035 and 2039. And that's all I have. I'm open to questions.
Commissioners, I'll open it up for questions. Commissioner Fairclough.
Joe, is there anything in the statute that would allow a county to, instead of going through the same machinations for a 4-year cycle that you have to do for an 8-year cycle, could you not use some kind of CPI type change? If housing costs in the southeast are going up 4%, could you add 4 times 4?
I'm not aware of anything in North Carolina. I think other states do allow that, but I don't know of anything in North Carolina that would allow that.
I know Florida does it every year. Every year they do it, and they got to have. Of course, the state laws are different, but
and I think Virginia does it every year. And they do something similar to what you're saying.
Yeah.
But there's nothing that I'm aware of in the North Carolina state statutes that allow that.
Yeah, I'll opine that in Virginia, we depending on where I was at, we did it every quarter or every year.
every quarter.
Yeah, but we use the CPI method most of the time.
Other commissioners, comments, questions? Shirley, quick question. Did you look at contracted services for this, like some other counties across North Carolina do?
I did not specifically for this presentation. I know for the current revaluation, we did reach out to a company to do our commercial services, and just the commercial part of the appraisal, they were wanting close to $4 million. And so we didn't go any further with them because we felt like that was going to be that would have been way too high for what we were doing. But so we have not really looked at that. We've done in-house 1988 was when the last time that they had an outside company do it. And then since then, 1992 forward, we've always done it in-house. And we've been staffed to do not 8 years, 7 years cycles. But I did not look at that for this presentation.
Commissioners, we don't need to take any action, any direction for staff on this that you want to see, or we'll just look at the information and then give the county manager further direction later? Questions? Okay, I don't think we'll take any action this time. I may have an interest in reviewing that outside contractor and getting more than one look, but we'll have a conversation with the county manager and look at that course of action. So,
Okay.
thank you for your time.
If you don't mind, I can just give you a quick update on where we are with
Yes,
this
sir.
one.
Please.
We did receive between 8,900 and 9,000 appeals, which
9,000.
we've already worked 1,200 of those. We had the first batch of informal notices will go out April the 22nd, and the last of them will go out somewhere around June 20th, which is within our 90-day period that we speculated that would take, and then we'll pull files July 1st for the bills. But all of those people in the informals will still get the 15 days to appeal to the Board of E&R. And at this time, we've received 41 board cases, but I'm sure that that's going to pick up. Yes, sir. All right.
Vice Chairman Jones.
Thank you, Mr. Chairman. And just one more question. I understand that you all had extended for those that are listening, you had extended the time period to get in the appeal. Is it May, or can you state that date
Yes,
when that
they
is the
can-
extension, please?
They can basically appeal to the BER. Anything we get now is appeal to the BER, and they have till 5 o'clock on May the 28th to get that in.
Thank you so much for restating that date.
Yes, ma'am.
We appreciate all the work. I know all the work you and your team have done over the last year, but especially over the last couple months during this reevaluation, especially the community engagement that you've done. I know that was an extra layer that we looked at this time in this process, so we appreciate all the work and the responsiveness.
Thank you very much.
All right.
Thank you.
We'll go ahead and move to item D, request to transfer funds to the Capital Investment Fund. County Manager Greer.
Yeah, as part of the Board of Commissioners, your policy, anything that's over the general fund unassigned fund balance of 15%, we transfer over to the Capital Investment Fund every year. Robin Coons will present that information and answer any questions you have. There's going to be also a separate request to this as we move forward to Monday regarding the ARP freed up capacity also.
Okay, good afternoon.
Good afternoon.
Thank you. So as County Manager Greer said, our policy allows this board to transfer anything that is in this unassigned line of fund balance that's over 15% of our total expenditures for the fiscal year to the Capital Investment Fund. And so this is just a snapshot of the ACFR report. The only difference is we did separate that line that you see as ARP freed up capacity, the $16,866,000. That was combined in our ACFR with the unassigned. But since you wanted to see that separately, we have pulled that out of the unassigned balance. So our unassigned balance is $86.8 million. Our total expenditures in the general fund, the combined general fund, is just over $415 million. So right now, if you look at the unassigned of $86 million as a percentage of that, it's just over 20%. This is just a quick snapshot of the three funds that make up the general fund. You'll see the budget numbers and the actual numbers. This is the general operating fund. In 2024, we had a fund balance increase of $20.2 million, and the fund balance at the end of the year in this fund was $179 million. This is the county school fund. Again, you have the budget and the actual that you can see there from the revenues and expenditures. The fund balance increase was just over $1.7 million last year, and the fund balance at year end was $25.9 million. And then the last one is the Capital Investment Fund. The fund balance increase for last year was $25.9 million, and the current fund balance, or the fund balance as of June 30th, 2024, was $173 million. So those are the three funds that make up all of this. So right now, if you look at those general fund expenditures as of 2024 in the general fund combined, they were $415 million. 15% of that, which is our policy, the part that we say we're going to keep intact, is $62.3 million. So then if you go back to that first original slide, if you'll recall, we had an unassigned fund balance of just over $86.8 million. So we're reducing that by this $62 million that we have to keep intact. And then we also reduce that by anything that we reappropriated at the end of 2024 to be spent into 2025. So Deborah and I have reconciled all that. Feel good about that number, so we're reducing it by another $8.5 million. And then we also did employee stipends in the fall of 2024, and that was based off of monies that were available at the end of 2024. So we reduced it by that $264,000 that was spent for employee stipends. So our allowable fund balance transfer, if you choose to do so, at this point is the $15,649,928, and of course that could go for debt service or future capital projects. The request, I'll answer any questions obviously, but the request is for this to move to the consent agenda for the 21st meeting, if you would like to make this transfer.
Thank you. Commissioners, questions? Hearing none. County Manager.
Go back a couple slides. The first one. Part of the motion that'll be on the meeting for the 21st is that you use the freed up capacity be pulled out of the unassigned fund balance, which it is denoted right there, and be a part of the assigned fund balance. You have to take action by the board in order to do that. You haven't taken action, so I just want to make that clear. And the reason why we want to leave the name ARP freed up capacity, we will request that stays in that name, use that name until December 2026, because if there's something that we have to return back, it'll be easier to we can pull it out as assigned fund balance and not use our normal fund balance. And it gives us a good tracking mechanism for the freed up capacity.
So, County Manager, just to clarify, you're going to want to add that as part of the consent item motion?
Yes.
Okay, not, okay. Additional questions, comments, Commissioners?
I didn't hear the request. What's the request?
The request is to
Move the whole 15?
move the $15.6 million from the general fund to the capital investment fund, and then also to make the designation with the ARP fund that the county manager Greer stated.
I'm sorry, make the destination to what?
To move this $15.6 million from the general fund to the capital investment fund, and then to get your approval to move the ARP freed up capacity out of that unassigned designation to an assigned designation.
Thank you.
Yes, ma'am.
Any additional questions or comments?
Thank you, Chairman.
Hearing none, I'll entertain a motion. Commissioner Patel.
So I'd like to make a motion that we go ahead and move the requested funds to the CIF budget, along with moving the ARP freed up capacity from unassigned to assigned budget for consent agenda on our April 21st, 2025 regular meeting.
I'll second the motion.
We've got a motion on the floor that's been seconded to transfer the funds, to transfer the fund balance to the capital investment fund, as well as move ARP freed up capacity from unassigned to assigned. There's been a second. Any further discussion? Hearing none, I'll ask for your vote. Raise your right hand in the affirmative.
Unanimous.
Thank you. And if you could send the commissioners those slides, because they were not in our
glad to.
deck.
Okay, will
We
do.
appreciate it.
Sure did.
To all commissioners, please.
Gotcha.
All right, we will go ahead and move to item 3. And we thought we were going to get the sheriff's office out of here sooner, but we will go ahead and move to items of agenda, consideration of items of agenda items. We moved, we'll go ahead and move to the recommendation for employee health care provider.
Yes, over the last few weeks, we've been interviewing healthcare providers to run and operate the employee health clinic. Ed Boardman is here with USI, and Robin Coos will present this item. We made a decision, a recommendation that they're going to make for you today and answer any questions you may have.
Okay, thank you again. So as you know, one of our most favored benefits to our employees is access to the employee clinic. And so over the years, that started out as an acute care facility, but it has expanded some over the last few years to also include some primary care as well. And so our current staffing model that we have in place has not been sufficient to meet all the needs of our employees. And so what that has resulted in is longer than desired wait times and then wait lists for some of our employees too. So in 2022, we contracted with Proactive MD as the company that was going to run that facility for us. And their contract ends this fiscal year. So we went out for RFP for proposals. We ended up with 6 vendors who proposed. In that proposal, they had an increased staffing model, 2 LPNs, 2 nurse practitioners, and a administrative individual. So we had them all to propose at that same level of staffing. We had 6 that responded. We interviewed 4, and then we brought our finalists 2 back for interviews last week. And this new model, again, is expanded to be able to meet the extended needs of our employees. So we have Ed Boardman with us again this week, and he's going to go through the presentation for you, and then we'll answer any questions that you have.
Good afternoon.
Good afternoon.
I know you have a long agenda, so I will try to make this brief and get through. I know Robin had given you the summary, and certainly we'll share this with you because I don't think this was in your packets prior, so we'll share this with you. But we did go through the process. It was about a 5-month process, and we're down to making a recommendation. And part of the, as Robin mentioned, offering the health center certainly helps provide access, and we know that's important because there's a shortage not only in this county but throughout the state, and really getting access so that you can avoid the utilization of the ER or obviously urgent care, and so it is a great benefit. So as you look at the 2 finalists that we chose, and we did go through the process. Proactive is your current provider, and then Marathon Health. Based on the staffing ratio currently, the Proactive has a waiting list for new patients, and there's a pretty long wait time for getting appointments. So Proactive proposed in a second I'll show you the staffing model, but their renewal cost is at $1.2 million, and that's an increase over the current annual cost, which is approximately $784,000. And a lot of that is really due to the increased staffing. Right now there is 1 nurse practitioner and 2 LPNs. The proposed model would be 2 nurse practitioners, 2 LPNs, and then 1 office manager, really to take on answering phone calls, a lot of the administrative work that needs to be done to run a health center. Marathon Health was the other vendor we chose. They were really a strong contender, but when you see the pricing, it really there's no advantage to moving. And I think really the bottom line is the provider itself. I know Allison is certainly well used, and I know people have grown fond of her as far as providing care. And when you change providers, it's like changing doctors. So we know that disruption certainly could cause employees either to not be satisfied and go elsewhere, but certainly want to make sure that doesn't happen. So the recommendation was to renew with Proactive at the increased cost, and using that opportunity, which it's really an investment so you can get more people to using the healthcare center. And I know right now at capacity, you got about 37% of your employees are actually using it. That's just over 800 employees use it, and there's over 2,000, that are eligible. And then the rest of the utilization is by dependent spouses as well as some children that also have access to the health center. The staffing model that you can see, this is the, and we did go back to all the vendors to make sure we quoted an apples for apples, because that did, when we looked at the comparison, the initial bids, we had to go back to a second round of bids to have everybody bid at the, the 2 nurse practitioners, 2 LPNs, and 1 office manager, and that really kind of level set the bids. So when you looked at the quotes, there really was anywhere from like 1.1 million, and the only outlier was one carrier of that 1.4. But as you can see, Proactive and Marathon were really very close as it relates to the total bid. So recommendation really, and this, before we get to recommendation, this is really just a timeline. So we're really at step 4. So we did the finals meetings, and really now would be to, if we were to move, certainly make that decision, but the recommendation is to renew the contract with Proactive MD for another 3-year term. And I'll open it up to really any questions. That was it.
I'll open up, Commissioner, I'm open up for questions. Commissioner Tyson.
Thank you, Mr. Chairman. So one question I have, in kind of how you formulated the structure in terms of staffing. I know I've talked to several departments within the county that have expressed some frustration, of course, about the long wait times and some of that. Talk us through why there wasn't proposed MD personnel on site included in the proposal.
So the question as far as increasing the staffing, so because I know right now the staffing ratio that was provided originally with Proactive in their contract was just the 1 nurse practitioner and the 2 LPNs, and it's not a certainly it's a hard thing to project the actual utilization. So I know that was one issue. So the utilization did increase, and then you also have the primary care component to it, which the acute care version there, that's a lot. As you can imagine, you go for acute care, it's you're just, when you wake up, you have a fever, and you really need to see somebody before you go to work or get a prescription. But the primary care really is the adds more time, and that was the piece that added to the wait times, congestion, and then ultimately Proactive was a partner with county. They did actually staff an additional provider at their cost, so they didn't increase their cost in the annual agreement, and as a result they did that, and they also had a office manager trying to alleviate some of that backlog in some of the administrative work, and so we felt they were certainly partnering with the county and trying to make things work, but that's getting to the new model is really Proactive based on their volumes and having at least enough room to grow so that they don't have a long wait time. They felt like they needed 2 practitioners to really accomplish that.
As a follow-up, Mr. Chairman.
Go ahead.
And kind of expand upon the second piece of this, the absence of a actual MD, a medical doctor, versus having LPNs and RNs, and kind of the justification for that.
Sure. And that's the model. I know that when we talk to Marathon Health as well as some of the other vendors, they have oversight of an MD. So there is an MD, and you'll see in the budget numbers that there is a fee for that service, because they do have access to a medical doctor, so that if there are areas that they need to consult on, they have that oversight.
Thank you, Mr. Chairman.
Commissioner Patel.
Thank you. So looking at the contracts and the pricing, if we were to be inclined to look at 1-year contract with Proactive instead of a 3-year contract, would there be an increase in pricing, or would it stay the same?
Yeah, that's a good question. We can certainly get that, for I know because of knowing that it would be more expensive, because I know the hiring, if they the staff knows that it's only a one-year contract, typically you risk losing that staff. You know, they'll start looking for jobs elsewhere. So we can certainly ask for that, but again, I don't know exactly, but I do think it would be an increase, you know, if you did a one-year contract versus a 3-year.
Yeah, I'd like to see the number on the 1-year contract. And then if we did do a 3-year contract, what is our recourse if we wanted to potentially change providers before 3 years?
Yeah, from a contractual standpoint, and I can confirm that, but I do know that, you know, for the renewal of the current contract, it was, I can't remember the penalty amount, but if there would be, certainly if it's a 3-year agreement, you terminate early, it would be a penalty amount. But we can follow up on those two items, the 1-year pricing and the actual termination penalty.
Just, yeah, if you don't mind, that'd be awesome.
Sure.
Commissioners, other questions? Oh, I'm sorry, Vice Chairman Jones.
Thank you, Mr. Chairman. Will this impact, well, the first question is, when is the next opening for open enrollment in regards for employees? And then I guess my second question would be, does that mean we need to make this decision before that for the impact? So that, does that impact or affect that being of what our employees have to, make a decision on? So when is our next enrollment for, employees?
Open enrollment, actually, we're
yes.
starting to plan already, so it'll be,
okay.
Between April and May, or the effective date of the new benefits is July 1, as far as the healthcare plan. But this renewal, the recommendation again is to renew with proactive. This would not impact their benefit choices.
Okay.
Yep.
Thank you for that.
Sure.
So, can you go back to the timeline? So we have to have a contract negotiation in May. So based on the request from the commissioners on the 1-year numbers and the term, you could bring that back in May. We could make a decision in May and still stay on timeline.
And we, as far as the claim, we wouldn't recommend changing vendors, but so they're renewing their contract. It would just be the hiring of those additional providers, because they do typically tell us it's about 90 to 120 days to get that additional practitioner, so they may not have the additional staffing hired by 7/1, but yes, you could. You could wait to make that final decision until May and still be fine, assuming again the recommendation is to stay with proactive and not change providers. If we're changing providers, then we would definitely we'd have to have a extension, in order to be able to meet that.
County Manager, anything to add? Board, is there a will that we want to see that 1-year pricing and that adjustment before we make a final decision? So we don't have to take any action today, we can just request action. We can just request this information. Go ahead.
I object to the 1-year thing. I think it just delays us. That's what I think about it. But I would rather risk the penalty on a 3-year cancellation within 3 years than to risk not being able to get it staffed up because you delayed it for the purpose of finding out what a 1-year program would be, and also for the risk you're taking by not being able to hire people that would only be there for 1 year. I think if you just have the penalty, like you asked about, within the 3 years, I think you've served your purpose. And that way we can get on moving with it. We don't have to come back. You don't have to come back. We don't have to come back.
I guess the question is, we don't know what that penalty is. That's.
Do you know what it is? Is it in the current
That's
penalty?
I have to get back to on the exact penalty, but there would be. They from terminating the contract early, there would definitely be a financial penalty for that.
Okay. Go ahead, Vice
You
Chairman.
might have already answered it, maybe it might have went past me. Are we, I understand that when the question was asked by Commissioner Tyson, but are we gonna look into what it would cost to actually have a MD? And the reason why I say that is respectfully, we respect all our nurse practitioners and our physician assistants, but it would be nice, just being transparent, for our employees to also have the option to be provided with the same services that private sectors that have MDs, just, putting that out there. And again, that we love all our, medical professionals, but that's just something to think about. It would be nice, in my opinion, for us as county employees, the same way if you get insurance on the outside for private, you get to have an MD, just food for thought.
Commissioner Patel.
So could it be feasible for us to get the penalty costs, the costs for if we want to have a position and cost for 1 year?
And so, go ahead, County Manager.
How soon would you want that brought back? Would you want it brought back by 1st of May?
Well, I think,
Or you want me to
Commissioner
send-
Faircloth's point, so we have two courses of action. If we want that information, if we can get it back before the consent agenda on the 21st, then we can leave it on the consent agenda. If we don't have that information back, then we can pull it.
I think we can get it before the end. I think we can get it before the end.
Is that acceptable, Board? Okay.
Thank you.
Thank you. All right, then I'll entertain a motion if there's no other comments. Commissioner Patel?
So I will make a motion to request the recommendation being presented today, along with the pricing for a 1-year contract, the penalty if we break our 3-year contract, and the addition of a physician to the staff, the costs associated with that, to be brought back to the Board of Commissioners on the regular meeting of April 21st for the consent agenda.
Is there a second?
Second.
And there's a motion on the floor to go ahead and move forward with our current provider, move that action to the consent agenda, in addition to the 3 pieces of requested information that we would receive before the 21st. Any questions on that motion? Discussion? Hearing none, I'll ask for your vote. Raise your right hand.
Unanimous.
Thank you.
Thank you.
We'll go ahead and move on to item B, selection of mural artists for America 250th mural at the headquarters library.
Faith Phillips, Library, Assistant County Manager Faith Phillips will present this item and answer any questions you have. We also have Joseph Winsendorf here to answer any questions as part of the presentation.
County Manager, are we closer to taking that librarian title off of her?
It's already gone. It's gone.
You're working.
Oh, there we go. Okay. Good afternoon, Commissioners.
Good afternoon.
So Cumberland County Public Library was awarded $25,559 from the America 250 NC Grants Program for their proposal celebrating Cumberland County's rich history and the Liberty Point Resolves. Joseph Wessendorf and his team in the Local and State History Department have developed a significant initiative that aims to educate the local community and the broader NC audience about Cumberland County's rich history and importance during the Revolutionary War era. Part of this project is the commissioning of a mural dedicated to the America 250 NC themes of Visions of Freedom, A Gathering of Voices, and Common Ground. The mural will also connect to important themes of our local history. So today, we are here to seek your approval of the selected mural for Headquarters Library. And at this time, I will turn it over to Joseph, and he's going to tell you a little bit about the process of selection of the mural artist. Joseph.
Good afternoon, Commissioners.
Good afternoon.
So, July 4th, 2026 is only 15 months away now. And I don't know about you, but I am getting excited since my department has a lot of stuff planned. And with that, as Assistant County Manager Faith Phillips said, we want to put a mural on the side of the headquarters library. And for reference, it will probably be on the Ray Avenue side of the building. So we developed an RFP, and the county set it out on January 2nd of this year, and the RFP closed on the end of February. We shared it with the Fayetteville Arts Council, along with the Arts Councils of Moore and Harnett counties, We shared it with all 3 of our local universities and colleges, FTCC, FSU, and Methodist, and we shared it with some local arts groups like the Cape Fear Art Studio. We got 7 applicants back, and we graded them based on the qualifications of the artist, the cost of it. Our budget relating to the mural is $14,000 as part of the grant, and we also graded it based on the design and the representation of the grant themes. Visions of freedom, gathering of voices, and common ground. The team that reviewed the applications consisted of myself and my 3 staff members, along with Assistant County Manager Brian Haney, Assistant County Manager Faith Phillips, PIO Director Diane Rice, and Lisa Jane, the County Grants Manager. And this was the recommendation, the top mural we had by an artist of the name of Max Dowdle, who is a North Carolina-based artist, and he has done a mural in Cumberland County before. If you're on 87, there's a Special Forces mural of a soldier, and that's his work as well. He, out of all the applicants, consistently got high grades across everyone who reviewed his application. He got a 90 out of 100. And looking at his design here, he has Charles Chestnut, famed African-American writer whose father, Andrew Chestnut, helped found Fayetteville State University. We have Lewis Leary, part of the Leary family, who his brother, Matthew Leary, also helped found Fayetteville State. Lewis was involved in John Brown's raid on Harper's Ferry. His family has a rich antebellum history to the county. The Marquis de Lafayette, since Fayetteville is named after him, and he ties into America's freedom and fight for independence, along with connection to desegregation of Fayetteville in the 60s and our military connection in history, along with, since it is on a library, there's a book. So our recommendation is that the county would support our recommendation for the artist.
Thank you, Joseph. Thank you, Commissioners. One thing that also stood out with this proposal is that this artist offered to do community engagement work. So have kids come out and do programs, paint days, that type of thing. And we thought that stood for what our mission was as a library. So at this time, we will answer any questions that you may have.
Commissioners, any questions or comments? Vice Chairman Jones?
Thank you, Mr. Chairman. This is actually a comment. First of all, excellent work up there. And second of all, I'm glad that he mentioned the Art Council. Appreciate all that the libraries do. Just want to take this opportunity in time. We know that our Cumberland County students at all schools, they definitely use the library to study as well as art. And I didn't get an opportunity last month, and it's better late than never. But I just wanted to say that we have some phenomenal artists in Cumberland County. I really appreciate the exhibition that they had provided. The Cumberland County was able to do a student exhibition of all the artwork, and most of the Cumberland County school systems participated in it. So I want to take this time to thank those students that participated in the fourth Friday. I think it ran for like 2 weeks. We did have a Cumberland County art exhibition for our students. They did a phenomenal job, and I'm very confident that one day from the work that I've seen in there, one of them will be putting in for a bid to have an opportunity to do a mural one day here in Fayetteville or elsewhere. So again, just want to thank the students that are listening, all the teachers and the library staff for what you do in our community to help support the arts.
Thank you.
Any other comments, Commissioners? Hearing none, I'll entertain a motion. Vice Chairwoman Jones?
Yes. I make a motion that we place this item on the April 21st, 2025 meeting as a consent agenda item to approve the selection of Max Donald and the proposed mural at the American 250 North Carolina mural for Headquarters Library.
Is there a second? A motion to move this to the April 21st consent agenda for approval. Been properly seconded. Any further discussion on the motion? Hearing none, I'll ask for your vote. Raise your right hand.
Unanimous.
Thank you very much.
Thank you, Commissioners.
And we will go ahead now and move to item D, tax payment to the IRS. Calling County Manager Greer.
Yes, I'll call up Robin Coons to present this item and answer any questions you may have. It's related to payroll taxes for fiscal year 2021.
Welcome back.
Thank you. So this is not a good presentation. It's a payment we have to make to the IRS. So in March of, the notice was dated on March 10th of 2025. It was an IRS notice CP 128 for an amount due of $110,771.14 to the IRS. This was related to a payroll tax penalty for calendar year 2020, particularly the last quarter. So obviously this has been some time ago, and the current staff, was not there at the time, so we've had to piecemeal a lot of things together over the last month. And we've talked to the IRS a couple of times. We've gotten the tax transcript, and this is what we've been able to determine. It looks like in 2020, due to the pandemic, there was some different kind of sick and family leave wages that were available related to the COVID pandemic. They were taxed at a lower rate than regular wages are taxed. It was like half. But during that time period, Cumberland County actually paid at the regular Social Security tax wage rate. So that was for the last quarter of 2020. So what the IRS did in the first quarter of 2021 was give the county a credit of $83,369.30, and that was for the overpayment that had happened at the end of calendar year 2020. So if all had ended right there, it would have been fine, and we wouldn't have had this issue. But for whatever reason, when the documentation was sent back in again to revise the 941s that had been prepared for the last quarter of December originally, they were sent in as regular 941s, not a 941X. I think that must have caused some confusion from talking to the IRS professional. And in November of 2021, the IRS sent that money back as a refund, and it was triggered based off of the revised 941 that was submitted. They sent that money back to us as a refund with interest. And I have confirmed, I've gone back to our bank account for that month and year and clearly see that deposit was made. In the meantime, couldn't tell you, why nothing was noticed until now, but we are receiving a penalty for non-payment and interest in addition to that amount that was refunded to us, which was not owed, for a total payment amount of $110,771.14. And I bring it today as a walk-on item just because we don't want to continue to not make this payment and perhaps incur additional penalties and interest. So we are asking this as a immediate approval to make that payment to the IRS after today.
Commissioners, questions?
I couldn't hear.
Commissioner Tyson, you recognize.
Thank you, Mr. Chairman. Question, and Ms. Coons, thank you for bringing this to our attention and understanding that this occurred before you were employed with the county.
Sure.
But based on your review, did you find that there had been any indication that this information had been presented to us prior to this March 10th notice being sent?
No, sir, I have not.
With that being the case, would the county be entitled to petition for penalty relief or interest charge relief since we weren't notified that this was due until March of this year?
I did mention that to the IRS professionals that I spoke with on the phone. They were not very, they didn't give me a warm fuzzy that would be the end result, but I think we go ahead and pay it, and then I can work on that some more to see if we can perhaps recover some of that. It's just, at this point, to pay the prior year invoice, we need the board approval to do that and pay it in full, and then maybe work on that on the backside just because of timing.
Thank you, Mr. Chairman.
Any other? Commissioner Faircloth?
I'm afraid I disagree with your course of action. The best course of action is when you owe tax and interest and penalty is to pay the tax and the interest, and then negotiate the penalty. You won't get any more interest, and you won't get any penalty on the penalty. So what I would do if it's determined that we owe this is only pay the interest and the tax. But this is not the first notice, okay? So can we dig back through and find some other notices that, you got it?
That's what I was going to say. This probably wasn't the first notice that we received. The first time I've heard about it was when Robert brought it to my attention. There were probably other notices that were received. We've had staff changes. Things move around. I do know it was probably, the penalty is probably correct. The amount of tax is correct based on it. Back in April of 2020, there was special COVID leave that was, FICA was taken at a lower rate. And I agree with Commissioner Fairclough. We need to just go ahead and pay it because the interest and penalty will accrue. But this wasn't the first notice.
Other questions or comments?
What's his recommendation?
The recommendation is to pay the $110,771.14.
That was my recommendation. I understand from Commissioner Fairclough that he would not recommend us paying, I guess, the failure to pay penalty of $5,001.94 of that total. So you let me know what you, I'll track it either way.
I will entertain a motion. Commissioner Fairclough, would you like to make that motion?
My motion is if you determine that the tax and the interest is correct, is to pay that and then negotiate the penalty.
Okay.
I'll second that.
We've got a motion on the floor to pay the balance and interest fees, withhold the penalty amount, which is of the total $110,771.14. Is there any discussion on that motion? Hearing none, I'll ask for your vote. Raise your right hand.
Unanimous.
Thank you. We will go ahead and move to item 4. There are no other items of business, so we'll go ahead and move to item 5, the monthly reports. County Manager.
Yes, in the spirit of time, does anyone have any questions on the financial report?
Commissioner Tyson.
The health insurance update, quarterly community development update, the grants update, or the projects update? If not,
Commissioners, any questions?
No, I'm too cold.
Hearing none, I'll go ahead and move to, we'll receive those reports, and we'll go ahead and move to item 6, Commissioner requests. And now we will move, first item that was moved forward, Sheriff's Office replacements, and I'll call on Commissioner Tyson, the Sheriff's Liaison.
Thank you, Mr. Chairman. I have Major Reyes here and Captain Morning with the Cumberland County Sheriff's Office, and brought this to the attention. They're going to brief us on the information that was provided in your packet. There's a consideration of replacement of departmental vehicles that were lost due to being involved in a traffic accident. And you'll see the memo that was sent by Sheriff Wright that's also in your packet that outlines that all the vehicles that are listed on that inventory were declared total losses, and that the insurance settlements have been processed on that, and that subject to that, we didn't really have a policy to replace and make the Sheriff's Office whole on those 26 vehicles they lost. And so I'll ask if Major Reyes and Captain Morgan can go to the podium, if that's okay, Mr. Chairman, to be able to provide some more insight and answer any of the board's questions.
That's fine. Good afternoon.
Afternoon.
Good afternoon.
Thank you for being here.
Thank you.
Commissioner Tyson, you want them to proceed?
Yes, please proceed.
Okay. Afternoon. I'm Captain Morning, Claiborne Morning. I am in charge of outfitting and upfitting vehicles for the Cumberland County Sheriff's Office. We have 26 vehicles that we would like to, that were declared lost by an accident. The insurance, from my understanding, was paid on those vehicles. and we would like to, if we can, please get those vehicles back.
Mr. Tyson, anything else you'd like for them to address or add? Major Reyes, anything to add?
Some of these vehicles were involved in accidents. Some were due to our fault, some were to the other drivers. And these vehicles, they were totaled, and they were never replaced. So these vehicles, we never got these vehicles replaced, and that's what we're asking for, to get these vehicles, because our fleet is depleted, and we have vehicles that their mileage is way up there, some of them 200,000 miles, and the maintenance on these vehicles are high, and we need to get these vehicles to be able to respond. We need dependable vehicles to be able to respond to these calls.
Vice Chairman Jones.
Thank you, Mr. Chairman. I just have two questions. Number one, you stated that some of the accidents were faults of others, but some were that you all were found to be at fault. So my question is, with the vehicles that you all were, how many that you all found to be at fault, then I guess the insurance not paying that? And I guess I'm saying for those that the other drivers were at fault, how does that work with insurance? Was that covered or not covered? Or help me understand that a little bit, please.
My understanding that they were covered, and those funds were paid to the county.
Okay, and so out of that, thank you, that's what I was asking. So those fundings, do you know how many, fundings that was paid to the county and the vehicles, can you give me a decipher, do you know how many were, the money that was paid to the county, this is what I'm trying to say, how many of those vehicles, I guess because that was those that weren't of your fault, how many vehicles was that, the amount of vehicles? Was it 10, 15? What was the amount of money given to the county for that to be taken care of? Is what I'm trying to figure out.
I'm not understanding what you're asking, ma'am.
What I'm asking is, you stated that that money was already, your insurance was provided to the county. So say if that of what you all not found at fault and the insurance said we're going to take care of 10 vehicles, do we know what that amount was given to the county and of how many vehicles apparently weren't taken care of because we're in this position?
I'm unaware of how much.
But you do know it was paid to us, though?
Correct.
To take care of this, and it wasn't. That's what I was trying to find out.
Yes, ma'am.
That maybe, hopefully, at least whatever amount of money that was provided to the county to take care of this for a certain amount of vehicles that you weren't, at fault for, if we could figure out a way to figure that out and see how maybe we can take action to at least take care of those. That's what I'm trying to ask. Does that make sense?
Yeah, I understand. You want to know what dollar amount of insurance has been paid against the total loss amount of the vehicles.
Right, and then how much, because out of that amount, I don't know how much, the vehicles each cost, but then maybe when we find that out, we can try to move forward to get some vehicles going on.
So of the 26 vehicles, I think the question is, of the 26 vehicles totaling roughly $2.2 million, I think the question is, what of that $2.2 million was reimbursed from insurance? Right. And that's not a you question, that's a staff question. And before we ask that, I'll redirect to Commissioner Tyson.
Thank you, Mr. Chairman. And I had requested that the sheriff provide this information so that we would have some framework and some guidance in terms of what we're looking at in terms of replacement liability cost. And my hope would be that the board would consider moving this back to our finance committee pursuant to our current board policies to allow that committee time and the staff to review this request, to get that information so we could bring it back to this board.
County Manager.
A few meetings ago, the board directed me, and we were starting this process of evaluating all of the vehicles that we had in order to come up with a vehicle replacement plan and policy. This would be part of that ask, and we're currently evaluating, making sure that we lay eyes on all of the vehicles, not only sheriff vehicles, but DSS, because we're going to need a funding replacement mechanism for both sheriff vehicles and DSS vehicles. So I would recommend that we hold this request till we actually finish that inventory and we bring that policy forward, because right now, as today's date, based on information that we have 385 sheriff vehicles. and we only have 252 sworn officers. So if my math is that we have excess vehicles than we have officers. And again, I'm a thorough, I had to get myself, I don't want to get myself in trouble, but public safety is, I believe in public safety. And so I just want to make sure as we go through this inventory and develop a policy that we make sure that we right size and we have adequate insurance for all of the vehicles that we have on the books, that we place the eyes on the book, on all the vehicles, so we can make sure in the future when we have these incidents that we can replace them. I think over the last 2 years, there's only been three or four vehicles that were totaled and don't really know the outcome. But most of the time when we have this, we allow them to use lap salaries or some other mechanism for them to replace the vehicle. And that's just due to staff changes and things like that.
So, to your point, County Manager, what's the timing that this board should be prepared to get that fleet report back? And I'm assuming it's going to come to the Infrastructure Committee.
First meeting in June.
Okay. Well, is that going to be impactful on our budget side? We're already going to be through the budget side.
Not for this fiscal year. It could be, but I would say I wouldn't put it. We already have replacements set in the budget. But what I would do is wait till after the results of the audit, similar to what we have with this transfer with the capital. If we have excess funds over the 15%, I would say we make a motion or we make the recommendation that we start a vehicle replacement plan with those funds and don't transfer the total 15% over to the capital investment fund. Based on what Robin presented today, our capital investment fund would be almost $200 million after this transfer. So we'll have a little flexibility and leeway in order to address the needs both for the Sheriff Department and social services. One of the larger concerns that I have, not outside of helping the Sheriff Department, but we have DSS employees that drive their personal vehicles on a daily basis, and the liability it opens us up to. So we need to really have a comprehensive vehicle replacement plan, and we plan to bring that forward in June.
Okay, and the plan is to bring it first to the Infrastructure Committee. Is that where you want to bring it to? Or where do you want to bring it to? As part of the fleet kind of inventory?
Well,
or where you want to bring it? It can then go to Finance after that.
Well, I just say we do a combined finance and infrastructure meeting.
Okay, we'll talk about where it comes to, but 1 June, we want to see that fleet, I think the direction would be we see that fleet program. The other thing I would ask, because I think it's a simple number to get at, that the Commissioner Tyson is requesting, so we've got a total cost just from what we see from the Sheriff. If we can look at the total amount, we should be able to go to the insurance side and say how much have we received from an insurance claim on any of the total vehicles. If we could just match those up and bring that back to the Finance Committee, the next Finance Committee meeting.
The next Finance Committee meeting is April 14th, Monday.
Oh.
3 o'clock.
Are you able to bring that back April the 14th?
It may be a tough ticket, but we'll try to get it. We'll try to purchase that ticket.
All right. Commissioner Tyson, you recognized?
Yeah, thank you, Mr. Chairman, and certainly appreciate the county manager's input on this. I know some of the frustration, especially from our Sheriff's Department, is that while they do have maybe a large number of total vehicles, their fleet is aging. And I know firsthand that they've had an officer involved in an accident due to an older vehicle that was having issues. So, the total number of vehicles doesn't necessarily represent the health of that vehicle. And I understand, I'm not the Social Services Commissioner, so I don't understand what their position is, but I am the Sheriff's Commissioner. And, these are resources that he needs now, not kicked down the road, not, to become a football to play with in our budget. This is vehicles that he lost that was no fault of his. And I believe this board's responsibility is to give him a prompt replacement so he can protect our community.
Do you have a recommendation from this? Does the course of action that I recommended as far as getting those two numbers, is that a first step, or is there other recommendations that you're looking to present?
As long as we can move this in an accelerated, deliberate timeline and it doesn't continue to drag on, then I think that that's what's important. But if this just keeps getting delayed, then I think that becomes an issue to the safety of our community and what the officers can provide.
So again, so if we have and I agree with you, Commissioner Tyson, thank you for bringing this forward. So if we have that information on the 14th at the next finance meeting, then we can make a determination. Does the board want to take action to go ahead and fund those vehicles before we get the fleet replacement policy that's going to be brought forward in June?
Yes, sir.
Okay.
I'd be supportive of that.
Okay. Vice Chairman Jones.
I can be in support of that. Thank you, Mr. Chairman. But yes, I do want to make sure that, because I am on the Social Service Board, and that is important, we don't want liability, and the social workers are already stressed enough with all these over cases. We want to take care of the sheriffs, as we know the sheriffs go to a lot of those social service calls, so it goes hand in hand. So I just want to make sure that, yes, I like the plan in place, and that we are mindful to make sure across the board for safety, as they also work with the Social Service Department on these calls, to make sure that in June, that portion that the manager said will go forth in June, which I think is reasonable enough time. That's my only comment.
Commissioner Patel?
Can I make a motion?
Sure.
I'd like to make a motion to move this item to Monday, April 14th's Finance Committee agenda at 3 p.m.
I second.
Just to clarify, so the action is to get those dollar amounts to come to the finance?
Yes.
And then identify any other next steps?
Yes.
Okay, just want to make sure we're all clear. Commissioner Tyson,
I'll second it.
Right.
Oh, I'm sorry.
I just want to make sure you're...
Yes,
okay.
yes.
All right, any other discussion on the motion that's on the floor? Hearing none, ask for your vote. Raise your right hand.
Unanimous.
Thank you, Commissioner Tyson. Thank you to our two sheriffs for being here for our meeting. Hopefully we saved you a little bit of time.
Appreciate it. Thank you.
We'll go ahead and move to back to the original item A, Local Emergency Planning Commission out-of-county applicants. Commissioner Tyson, you're recognized.
Thank you, Mr. Chairman. The Local Emergency Planning Commission met for the first quarter of this year, and you will see in your packet that there was a request for companies that are located here in Cumberland County to be able to send an employee representative of that company to the LEPC to take part in those exercises. I actually had the pleasure of being able to take part in an exercise this week, and I can tell you that having our industry partners at the table with this and going through this is vitally important. A lot of the employees with these companies, they would like to send their safety officer or their emergency planning team, but if they're not a Cumberland County resident, the current policy would preclude them from serving on that commission, which is really the point of the commission, is to engage local industry. So out of that, you'll find in your packet that there was a memo that was sent from the LEPC requesting that the board consider an exemption to that policy that we have. And so one of the things that we also need to do is to go ahead and confirm the chairman and the vice chairman of that board. So that's something else that we need to do. But for this item, I would ask that we consider moving this to our policy committee per our current board policy that was adopted and approved for consideration and be brought back to the board.
There's any discussion, Commissioner Patel? Commissioner Fairclough?
Oh, I'm sorry, was that a motion?
No, it wasn't a motion yet.
Okay, but you wanted discussion, okay. I agree with what he's saying, and yes, we need to do exactly what he's asking. I will say that I told Gary at the first meeting in 2023 to just bring it to the clerk to get it put on the board's agenda. So here it is, almost and a half years later. So anyway, yeah, we need to support that.
Commissioner Patel.
So thank you, Commissioner Tyson. I'd like to make a motion to bring this or send this to the policy committee and just acknowledge that the policy committee do take into consideration that there may be other boards and commissions that come down in the future, so if we could have an encompassing policy.
Is there a second?
Second.
We've got a motion on the table, properly seconded. Any discussion or questions on the motion? Hearing none, I'll ask for your vote. Raise your right hand in the affirmative.
Unanimous.
And we will go ahead and move forward to item B of Commissioner request, Unified Development Ordinance, UDO update. Commissioner Patel, you're recognized.
Thank you. So to keep this a little bit short, I know that our county manager's office and attorney's office and staff in general and is pretty busy these days. Looking at our UDO process and the updates that we need, specifically for process efficiencies, ordinance reviews, tier development incentives, clarifications of roles and board training, legal review processes, performance metrics, and restructuring of review authority. In order to expedite this process, I think it'd be in the best interest of our board and our county to look at hiring an independent contractor to work directly with our planning director, our county manager, and a board of commissions and needed committee stakeholders. And I will mention Director Rawls Howard's here if you do have any questions, but he did mention to me before the meeting started, we do have some ordinances that haven't been looked at since 1995, so it's a necessary move that I think we need to take, especially if we want to look at organic development in our county and both in a sustainable manner. So if the board would allow, I'd like to see if we can move that to the policy committee and get someone hired. And I believe Director Howard, if you've got anything, or I know you're working on an RFP process currently.
Here, doesn't matter.
Up there, because we're streaming. Good afternoon.
Good afternoon to you too. Thank you very much. I would just say that whatever direction the board wants to take in this, staff is absolutely excited at the prospect of doing this. We have ordinances, as Commissioner Patel had mentioned, that haven't been updated comprehensively since 1995. We have various stages of modernization of these ordinances. So, I mean, the basic framework is wrapping in our zoning, our subdivision, floodplain, like the watershed, street naming ordinance. It's about a half dozen of them. And putting them all together in one place has its pros and cons, but I think for the county, definitely it's a pro, if we can go in that direction.
Vice Chairman Jones.
Thank you so much, and we appreciate the work that your planning team does. And for those that are listening, not to get in too much detail, can you give an example how this would be since like you said, 1995 or 85, how this would be a great benefit for our community? You can give an example of once you put something in place, just one or two examples for our listeners. Thank you so much.
Yeah, so I mean, pros include, I'll give you about three. How about that?
Okay, thank you so much.
Yeah, so first and foremost, you're going to be looking at a one-stop shop document for largely all of our development regulations. Secondly, it will streamline and modernize our administrative and appeals processes that are scattered all throughout those half dozen ordinances. And then three, right now since we have segmented ordinances, when we have to make changes to one, there are tentacles that are attached to all these and cross-references. So if you have to make a change to one, and you'll see this actually coming up with the subdivision ordinance that we're working on, is that I have to bring changes not only to the subdivision ordinance, but the zoning ordinance with it, because they're changes that are all tied together. So that'll do away with all of that. It'll streamline it into one process.
Thank you. I'm sure that helps our listeners understand, simplify how this is going to be a benefit. I appreciate that.
Yes, ma'am.
Commissioner Tyson, you recommend.
Thank you, Mr. Chairman. I just wanted to state that I am in support of Mr. Patel, Commissioner Patel, and his recommendation. This is something that is vitally needed for us to take a look at. And I believe that when the chairman was on City Council, one of the initiatives that your board took at that time was to set up a task force style review of the cities, some of the city's ordinances, and that allowed community stakeholders to be able to collaborate in this. I would strongly encourage that this be a collaborative process so that we can get many voices at the table to make sure that this work product, the result of that, is the most efficient and the best for our community and our residents. So I would just add that as well.
Any other comments or discussion? If not, take a motion, Commissioner Patel or Commissioner Tyson.
Thank you, Mr. Chairman. I would make a motion that this board move forward with a task force style unified development ordinance update, and that we work to bring stakeholders to the table to start the collaboration process to look to adapt and change our development code.
Bring that back to policy.
And to bring it back to policy, to consider that.
Is there a second?
Second.
Any? Commissioner Fairclough, seconded. The motion on the floor has been properly seconded. Any questions or discussion on the motion? Hearing none, I would ask for your vote. Raise your right hand in the affirmative.
Unanimous.
Thank you, Commissioners.
Thank you.
Thank you. We'll go ahead and move to item C, municipal infrastructure, less than 10,000 K population. This is a commissioner request that I brought forward. This stems from conversations and meetings with our municipal mayors, as well as municipal boards. We have several of our less than 10,000 in population communities that are struggling right now with infrastructure, specifically water infrastructure. They need water infrastructure so they control their own systems. In each one of these cases, so you look at a Falcon or Godwin, for example, they're working towards providing water for residential development, which would be economic growth for that area, as well as in Stedman, the same types of things. So there's infrastructure needs that their systems have. I would like to recommend that we direct staff, and I've had some preliminary conversations with staff, but I didn't want to go too far without board direction and agreement, but direct staff to look at an option to provide for the county to provide and fund the infrastructure, and the municipal. So we would own the infrastructure, and the municipalities would then pay the capacity back to us. I'd ask that be looked at and brought back to the infrastructure committee in May with a potential course of action for this board to look at. So that's, I'll open it up for any discussion. Commissioner Tyson.
Thank you, Mr. Chairman. And I just wanted to express my support and wanted to thank you for your leadership in bringing this item forward. I am in total agreement with you that a lot of our smaller municipalities, which are vital to the character of this county and this community, do need some strategic help and support. And if we can provide a pathway to that, I believe that we should. And so I'll certainly yield to the discussion to any of the other commissioners, but I'd be happy to cast that motion or to second it when the appropriate time comes, Mr. Chairman. Thank you.
Any further discussion? Commissioner Fairclough?
I got a question for the county attorney on this issue. Do we have to have some kind of interlocal agreement or something like that to do this, or what do we have to do?
Well, the only way we can transact business with cities or towns is through an interlocal agreement, but I think there's maybe a larger thought process in play here. In my understanding, we may be looking at the county developing the infrastructure and doing it that way.
So, Commissioner Fairclough, as part of this process, we would involve the county manager. County manager and I preliminary had some discussions about it. Again, I didn't want to step too far forward in front of the board. I wanted to get some consensus to bring it back to infrastructure.
I just know from history there's always a back and forth on those things, and so you gotta have everything just right.
Yeah, and Commissioner Fairclough, you've heard me say many times, we can't give money away. No,
right, exactly.
And let me be clear, we're not giving money to municipalities. That's not what I've asked. I said we are going to build, and they're going to pay us for that capacity. So I'd ask that the due diligence that would happen at the staff level and in conjunction with the attorney, and they bring back a course of action for the infrastructure committee to look at in May. Any other discussion? Commissioner Tyson, I would entertain that motion if you'd be glad
Thank
to
you,
make it.
Mr. Chairman. I make a motion that we direct staff to provide and fund the infrastructure municipality for payment for capacity and bring that to the infrastructure committee at its May meeting.
Is there a second? There's a motion on the table to direct staff to provide us an option for the county to provide and fund infrastructure whereby the municipalities provide back payments for that capacity. Look at that and then provide it back to the infrastructure committee in May. Any questions on or discussion on that motion? Hearing none, I'd ask for your vote. Raise your right hand.
Unanimous.
All right, thank you, commissioners, and we are moving to item 7, closed session, so I will entertain a motion from Vice Chairwoman Jones.
I make a motion that we move to go into closed session for economic development matters pursuant to NCGS 143-318.11A4 and for personal matters pursuant to NCGS 143-318.11A6. And if needed for attorney-client matter pursuant to NCGS 143-318.11A3.
Is there a second?
Second.
Motion to go in a closed session for the items mentioned. Any discussion on the motion? Hearing none, I ask for your vote. Raise your right hand. And we're in closed session. And I'll go ahead and call on Vice Chairwoman Jones for a motion.
Yes, I make a motion that we, first to move to come out of closed session for economic development matters pursuant to NCGS 143-318-11A4, and for personal matters pursuant to NCGS 143-318.11A6, and also for our attorney privilege pursuant to NCGS 143-318.111A3.
And there are no items of action from the closed session, so I will entertain a motion to adjourn at this time. Is there a second? Motion to adjourn, properly seconded. All in favor, raise your right hand. And we are adjourned.